Good evening, one and all. Aptas Ayurveda Trust, in association with World Ayurveda Foundation, presents Kai Chikitsa Ratna, late Vaidya G. Srinivasa Acharya Memorial, Punarvasu National Level Seminar on Ayurveda, Trichology and Cosmetology. Myself, Dr. Ananya Lata Bhatt, first year PG scholar from the Department of Agriculture, STM Hassan, welcome all of you for the Punarvasu National Level Seminar. I request Dr. Mahesh sir for the welcome speech.
Good evening to one and all. I am Dr. Mahesh Irulal, Associate Professor, Department of Roganidana. I wholeheartedly welcome all the participants and the judges for this today's PG session 2. Today we have the two distinguished judges for this session. First, I welcome and introduce Dr. Govind Sharma K. Sir born in 1976 in Kasaragod, Kerala, and Sir pursued the BMS from Mysore University and MD in Rashastra in 2006 from University of Kerala. Sir is presently working as Associate Professor in Department of Rashastra and Vaishya Kalpana, STM College of Ayurveda and Hospital Hassan. Sir is a sixth rank BAMS from Mysore University and the recipient of Dr. Virendra Hegde Pattabhisheka Award for Academic Excellence. Sir is having a teaching experience of about 18 years for UG and 15 years for PG teaching experience. Sir has 5 research grants and published 64 peer publications in peer-reviewed journals. Sir has participated as a subject expert, and Sir has a resource person for 36 seminars, training workshops, and Sir has joined as in 5 training programs, workshops, etc. Sir is a recognized RGHS PG guide and guided the 17 PG scholars till date. Sir is the coordinator for Peripheral Pharmacovigilance Committee of STMCAH Hassan, and Sir is the faculty for short-term courses for the international training programs. I welcome you, sir, for this session, sir. And we have the another distinguished judges for this session, Dr. Madhukeshwar Hegde. Madhukeshwar Hegde has completed the MD from Taranath Government Ayurvedic College, Ballari. Sir has the Associate Professor and the Pharma Consultant for New Product Development. Sir has worked in R&D unit of Prakriti Products, the consultant for Ayu Rashmi Herbals, Alpha Naturals, Med Organics Pharma. Presently working as Associate Professor, Dhanvantari Ayurveda Medical College, Siddhapur, Karnataka, and guided a student for face mask development and its efficacy study for the RGHS grants. I welcome you, Dr. Madhukeshwar Hegde.
Thank you, Mahesh sir.
Thank you, sir. Uh, Over to the moderator for the session.
Thank you, Mike sir. Now I will read out the rules and regulations. Presentations are carried out in the same order as previously notified. Presenters must be ready with their presentations and must present in your turn. Time limit is 4 plus 2 minutes. Strictly adhere to the timings. If time exceeds, the presenter will be muted. Participants who are presenting must switch on the audio and others must be on mute to avoid the disturbances. Now we will start the first presentation. First presenter is Dr. PVR Sri Sharmada from Shushruta Ayurveda Medical College and Hospital. Title of the presentation is Effect of Shami Bijadi Lepa in the Management of Athiloma with respect to hirsutism. Over to you.
Good evening, respected organizers.
Share your screen.
Just a minute. I'm unable to share the screen. Just a moment.
Dr. Nandini, are you ready?
Yes, ma'am, I'm ready.
Okay, then please share your screen. The first presenter is Dr. Nandini A from Amrita School of Ayurveda, Amrita Vidya Vishwapeetham, Kerala. Title of the presentation is Embracing Ayurvedic Cosmetology for Post Chemotherapy Skin Rejuvenation.
Ma'am, is it visible, ma'am?
Ma'am, turn on rotation.
Sorry?
Yes, ma'am. Now it's still not visible.
It,
Participants, please note, if you are presenting and sharing the screen from laptop, then select entire screen when you will be sharing the screen. And if you are using mobile, please turn, that is the switch on the rotation option, or else it won't be visible in the appropriate mode. Dr. Nandini, are you ready?
sir,
Or should we
sir,
move to the other presenter?
sir, I'm not able to do that. I'm trying.
And I request everyone, please, if you have laptops, please try joining with laptop only. So we'll move to the next presenter and we'll make these two presenters later.
Next presenter is Dr. Vaishnavi BR from Ayurveda Mahavidyalaya, Hubballi. Title of the presentation is Classical Formulations in Cosmetology and Trichology, a comprehensive review from traditional text. Dr. Vaishnavi BR. Dr. Vaishnavi BR.
Dr. Vaishnavi, are you there? First presenter, are you ready?
Dr. Sharmada, are you ready now? Sharmada,
Yes, ma'am.
please share your screen.
Yes, yes. Is it visible, ma'am?
Yes, it's visible.
Is the screen slides are changing?
Yes,
Yes,
yes.
Okay.
Okay, your time
Uh,
starts now.
Yeah. Good evening, respected organizers and judges. My topic of presentation is effect of Shami Bijadi Lepa in the management of Athiloma with special reference to hirsutism. Myself, Dr. P.V. Sri Sharmada, second year PG scholar, Department of PG Studies in Dravyaguna, Srishta Ayurvedic Medical College and Hospital. So to begin with, it is to begin with the it is skin represents the outward appearance to the world, and the social stigma associated with the hirsutism results in the morbidity and psychological stress. So especially in case of adult females. So in India, the incidence of hirsutism with PCOS is 44.16%. Among them, 83% had hyperandrogenism. According to Ayurveda, Loma is considered as a Pitruja Bhava, which is attained from the Pitruja Bhava. And according to Charya, in 21st chapter, Sutrasthana, he mentions Atiloma Purusha is considered as Nindita. But which and Kashyapa Samhita, in Kashyapa Samhita, he mentions Pushpagni Jataharini, which is characterized by Sthaulya and Lomashaganda, which can be clinically correlated with hirsutism in PCOS. All the females produces androgens, but due to the higher than normal levels, it can lead to hirsutism. Hirsutism is defined as the presence of terminal coarse hair in females in a male-like distribution at the sides of the face, upper lip, chin, and abdomen and upper abdomen. So symptoms of the hirsutism, it has hairs developed in the cheeks and chin, acne and the pimples, skipped menstrual cycles, periods that come and go unexpectedly, excessive insulin production, inability to conceive, and masculine voice tone and greasy skin. So there are many modern techniques which are available. Those are considered like photoepilation, laser epilation, electroepilation, like razor shaving, hair removal creams, waxings, and epilators. But usage of these things can lead to lesions, skin inflammation, and itching, minor burns, etc. So, to prevent this, a safe and effective treatment is needed. So, the present view was carried out to see the efficacy of Shami Bijadi Lepa in Athiloma with special reference to its hirsutism. So, coming to its pathophysiology, to hair growth cycle has three things, that is anagen phase, catagen phase, and telogen phase. So the conversion of development of the terminal hair occurs due to the presence of androgens more. that conversion of the vellus hair to the terminal hairs is mainly stimulated by androgens through the prolongation of the androgen stage. So the longer the androgen duration, the promotion in the increase in the follicle size will be there. So these larger follicles produce the longer, thicker hairs in the androgen, which are dependent body on the dependent body areas. So for this reason, there is an androgen excessive related conditions will have like hirsutism will have more amount of the hair. So objectives of this study is to understand the utility of semi-bijadilepa in the management of hirsutism and to find a safe, effective topical application for the hirsutism. So materials which are required is Shami Bija and Kadali Kanda and Dhirka Vrunta, which is nothing but Shonaka, and Haratala, Saindavalavana, and Shita Jala. So method of preparation of this is Kadali and Dhirka Vrunta has to be dried and made into Basma form separately. And Shami Bija, Haratala, and Saindavalavana are made into fine powders separately. All these ingredients are taken in the equal quantity and mixed with Shita Jala. So coming to the its rasa panchakas, it is Shami has Tikta Katu Kashaya rasa and Shita Guna, Lagu Guna, and Shita Virya Katu Vipaka. It acts as Kapahara and it Rogagnata is Kasahara and Keshahanti. So Kadali, it is Madhura and Kashaya rasa which has Guru Snigdha Guna, Shita Virya and Katu Vipaka. It acts as Pitta Vata Shamaka and Karna Shulahara and Shomaroga Nashaka, it has been mentioned. And Dhirga Vrunta has Tikta Kashaya Katu and Madhura Rasa, Lakhu Ruksha Guda Ushna Virya, Katu Vipaka, Kafa Vata Shamaka, and Pachana Rochana. And Haratala, is being Katurasa Snigdha Guna Ushna Virya Katu Vipaka, and Vata Kafa Shamaka, it acts as Roma Shatana. And Saindhavalavana has a slightly Madhura Rasa, and Guna it has Lagu and Snigdha Guna. Shita Virya, Katu Vipaka, Trilokshagna, Ruchya, Deepana, and Roma Shatana. So Jala it has Avyakta Rasa and has Kafa Vatahara and Trushnagna and Hridya. So probable mode, coming to the discussion, it is a probable mode of action of the Shami Vijadi Lepa. Due to its Katu Vipaka and Ushnavirya, it acts as a Deepana of Brajaka Pitta and Laghu Ruksha Guna and Sukshma Guna of those Dravyas will act as Shroto Shodhana and Saindhava Lavana, which has Sukshma and Chedana Guna and penetrates into the skin through Lomakupa, and there will be Svedakshaya. Not only these things, and most of the drugs are Kapha Hara, and which can leads to Vata Prakopa. Due to its Ruksha Guna, it can destroy the Lomakupa. And probable mode of action of the Haratala. So there is pyruvate dehydrogenase complex will be there. The dysfunction of this pyruvate
Your time is
dehydrogenase
over.
complex. Thank you. So with this, I can conclude that the Shami Bijadi Lepa acts as a Loma Shatana in case of Atiloma.
Thank you.
Thank you.
Judges, you can ask any questions. Judges, please ask questions.
Dr. Sharmada, please put your title slide.
Yes, sir.
Yeah, looking into the title, I thought that this is a research work which is done on some like a preclinical model or a clinical model. But
Yes,
the content of the presentation did not match with the title. That is what I felt. Do you have any justification?
Sir, the Shami Bijadi, which has been mentioned in the Shushrutacharya, like in case of hirsutism, this works as an epilator, sir.
No, I understood that. But your title, title of presentation,
Yes,
so
sir.
that's what I told you put your first slide, effect of Shami
Shami
Vijay
Bijadi Lepa.
management of Atiloma with the special reference to hirsutism, your title.
Yes,
So
sir.
the title, just looking at the title, I feel that it is a research work done on some some patients or some preclinical models.
Sir, not by me, sir, but some of them has been done on this, sir.
Then you should have presented the research data in your presentation.
Okay, sir.
And nowhere your presentation contains the research data on the effect of Shami Bijadi Lepa. Your content contains the review on the mode of action of the ingredients of Shami Bijadi Lepa. So it's a review. It's
Yes.
not a research work, it's a review which you have done of some research
Yes.
work which has been done earlier. So probably your content of the presentation doesn't match with the title.
Okay, sir.
Yeah. And in the second slide, you were telling, when after telling the need for study,
Yes, sir.
you have claimed that finding some safe and effective remedy for hirsutism is the need of hour.
Yes, sir.
And you have never done safety study nor the efficacy study in your work. Have you done?
Sir, no, sir.
No. Okay. And the last question which I have is, in the
Yes, sir.
ingredients you have told that the kadali and shonaka were powdered and added to the other ingredients.
Yes, sir.
Yeah. Whether kadali is added as a powder or kadali kshara.
No, sir. Kadali Kshara, like it has, that's what I have mentioned. It is a Kadali Basma, which is nothing but a Kshara preparation which has to be done, and then we have to add it into the ingredients.
Okay. You have to prepare kadali kshara and add, right?
Yes, sir.
Okay. Yes. Sir Madhukeshwar, sir. I have no more questions.
Yes, as sir mentioned, it looks like a clinical study, but is there any reference? Is there? Have you referred after applying the Shami Bijadi Lepa, how many days it will act as a Loma Shatana, and after that, how many days it will reappear? Is
Sir,
any, have you referred in that any research article?
Yes, sir. Based on the thing, what they have concluded is like with the like I have mentioned it in the thing modified Ferriman Galway score. So there they have told that based on the hair density, regrowth, and burning sensation, they have concluded that with the this Shami Pejadi Lepa, there was no regrowth of the hair, and then hair density was also reduced, and burning sensation was also reduced in that, sir.
Yes,
So due to the
usually
presence
why
of the
it means
Haratala,
usually
sorry.
even usually what happens is if any creams also is there, which hair removal creams also is there,
Yes, sir.
it acts for only short period. After that, again regrowth will take place because it only removes the upper portion of the hair. It will not remove the its bulk part. That's what. So, if any efficacy means how many days it reappears. Based on that, we can justify this product. So, in the market, if you want to launch or if you want to come up with this product, means depends
Yes.
upon the how many days it will stay. That means once the person applies, so how many
Yes.
days it stays. Based on that, efficacy of the product will be there.
Sir, for this
one more
we
question.
have, yes. So for this we
Is
have to
which
do
Haratala is
the
used?
prolonged studies and then know how long this will not reappear, sir.
Yeah.
That can be a scope for further study.
My second question.
Yes, sir.
Yes. My second question is which Haratala is used?
Sir, they haven't mentioned any specific haratala which has to be used, but in the market, which we get is only one haratala, which is patra haratala, sir. So, like mostly which we get is patra haratala. So that whatever is available, we can take it as an. But in Shushruta, with reference, it has not been mentioned which haratala has to be taken and utilized.
Yeah, is there? Is the specifically it is mentioned? Now, Patra Haratala is not used for the Loma Shatana purpose. Only Pinda Haratala is used for the Loma Shatana purpose. Of course, we can use it, but classically it is mentioned as Pinda Haratala is used for the Loma Shatana purpose.
Yes. Okay, sir.
Okay, no more questions. Thank you.
Thank you so much, sir.
Thank you. Now we will move on to the next presentation. Next participant is Dr. Nandini A. College of Amrita School of Ayurveda, Amrita Vishwa Vidyapeeth, Kerala. Title is Embracing Ayurvedic Cosmetology for Post Chemotherapy Skin Rejuvenation.
Dr. Nandini, please open the PPT after sharing the screen.
Next presenter, Dr. Vaishnavi, are you ready?
ಅದರ ಆನ್ ಆಗಿತ್ತು ನಿಮ್ಮ ಪ್ಯಾನಲ್ ಮತ್ತು ನೆಕ್ಸ್ಟ್ ತರಿ ವೈಷ್ಣವ್ ಶ್ರೀಧರ್ ಇದ್ದರು.
Hello.
Yes, ma'am,
Hello.
are you ready?
I'm not able to share the screen. Please, can you share the screen? I
Please
already
share.
shared the PPT
So
to
after
some.
sharing, please open the PowerPoint. Now your screen is visible. Please open the PPT.
Is it visible, sir?
Yes, ma'am, it's visible. Yes, ma'am, you can start presentation.
Om Amriteshwari Namaha. तदैव युक्तं भेषजं यदा रोगाय कल्पते स चैव बीजं श्रेष्ठो रोगाभ्यो य प्रमोचयेत्. The best medicine heals without the upadrava, and the finest physician cures with the least medicine. Namaste to all the respected ones. I am Dr. Nandini A, PG scholar from the Department of Samhita Siddhanta and Sanskrit. This presentation showcases the completed PG dissertation work. Today, my topic is Embracing the Ayurveda Cosmetology for the Post Chemotherapy Skin Rejuvenation. Introduction. Cancer is such a grievous disease. Multi-kinase inhibitors acts as a double-edged sword, offering both efficiency in treatment and also causes multiple adverse reactions. About 48% of the world cancer cases contributed all alone by the Asia itself. Hand and foot skin reaction is one of the major mucocutaneous adverse reaction, incident rate above 35%. In Ayurveda perspective, hand and foot skin reaction may be understood as Pitta Rakta Pradhanada Agantuja Vrana caused by Tikshna Aushadhi. Moving to the aims and objective, the aims and objective of the study conducted was change in the signs and symptoms of the hand and foot skin reaction, were objectives like change in the grade of hand and foot skin reaction based on the common criteria, uh, um, adverse reaction version 5, and change in the severity of the pain according to VAS scale, and the quality of the life of the patient is also elicited by quality of life questionnaire. This is null hypothesis and hypothesis. Moving to the methodology, the today's presentation's aim is to find out the wisdom of Ayurveda along with the modern oncology. Methodology followed is in this study, it was a non-randomized control trial with a sample size of 22 patients conducted at the Medical Oncology Department of Integrative Medicine, AIMS Kochi. In the exclusive criteria, the dermatological toxicity is not induced by multicutaneous inhibitors are excluded, whereas in inclusion, where 18 to 60 years of the patients were included and the life expectancy more than 3 months, patients were concentrated more. For the diagnostic criteria, I used common terminology criteria. Adverse reaction version 5 is taken under consideration, where all 3 grade of hand and foot reactions were included. Moving to the treatment group, as an add-on to the standard of care, the intervention was given and maintained for 1 hour interval between the standard of care and our treatment, where Parisheka was done with day 1 to day 30th with a 1 liter of Estimadu Kashaya at the room temperature for 15 minutes is done. And for a Lepana, from the day 6th to day 30th, Shatadauta Gruta quantity sufficient is taken and applied immediately after the Parisheka. It is also done twice a daily. As a standard of care in that hospital, in grade 1 hand and foot skin reaction, moisturizing creams like urea and salicylic acid creams is used. In a grade 2, it was like corticosteroids along with an analgesics were used. In a blister, in a grade 3, it was an antiseptic were used. Moving to the results of the study, where you can see the main difference between the quality of life of the patients, where in treatment group it was 19.6, in a control 4.3. Moving to the pain scale, using a VAS scale, it was elicited a mean difference in a treatment group, it's 2.7, where in control was 1.1. We can see in the picture also the wound from the before the treatment, after the treatment, there was a significant changes in the patient's wound. Moving to the discussion part, whereas in this is a pathophysiology, where hand and foot skin reaction is a condition where increased chemotherapy dose leading to the direct toxicity, where hand and foot are the parts of the body where there will be highest number of sweat ducts. Presence of an Arakin ducts where leads to the sweat ducts. There will be signs and symptoms of multikinase inhibitors are expected for exhibited more. Moving to the Gruta, like how Gruta is helped in this condition. These are the 4 studies carried out where it explains about the importance of the Gruta, where it helps in healing the wound. Cell-cell interaction and in transduction and proliferation helps in the development of a new epithelial cells and helps in wound healing. This is the probable mode of action of Parisheka with Estimadu Kashaya with a Lepana and Lepana with Shatadauta Grita. We know the Estimadu is a Dravya having a major importance where it plays a very important role in a wound healing. According to Charakacharya, he mentioned 11 times in the 50 Mahakashaya Varga exhibit their importance in treating a diseases. Whereas in the hand and foot reactions, where we can consider Pitta and Rakta is affected is Pitta Pradhana Tara Bhava, whereas Vata it is affected in Pradhana Thama Bhava. Estimadu contracts this with and has it is a Shita Guna and Madhura Rasa, contracts a Pitta Rakta, dosha affected. In Shishruta Vrana Chikitsa Adhyaya explains Parisheka helps as a fire extinguisher. In the same way, analogy is taken here. To counteract the Vata and Ruja, Tvak Prasadana, Shatadauta is the best, having a Shita Guna. In Nibandha Sangra explains about the Vrana caused by Visha. At some extent, I can take this Visha as a chemotherapy-induced condition. Moving to the conclusion part, we already know the Shuddha Chikitsa. With the Chikitsa, we should not cause any other conditions by suppressing a main condition. That should be considered as an ideal treatment. To fulfill this, where if you are suppressing the adverse reaction, a patient can survive more, take more chemotherapy, we can add some little days to him. This treatment is non-invasive, low effective. We can use integrative medicine is best, already told by Shushruta. One Shastra, it is not possible. We can take an integrative medicine and we can treat the condition in a better way. Thank you. I want to conclude this presentation by saying Samyak Prayoga Sarvesham Siddhirakyati Karmatha. Thank you, one and all.
Thank you. I request judges to ask any questions.
Doctor, this work is done by you?
Sir, it was done by one of our seniors, sir.
Okay. So I have specifically 2 doubts. One is,
yes, sir.
what was the statistical method which was adopted by, you had how many groups in the study?
Sir, it was only a single a comparator group and one group was, sir, control group.
Yeah, there was a control group where
Yes.
only chemotherapy was done, and another group where chemotherapy along with this Parisheka and Lepa was done, right?
Sir, in the conditions where standard of care, what is mentioned in all three grades, they're having a specific conditions like grade 1, grade 2, grade 3, they're having their specific treatments, sir.
Yeah.
Along with that, we are adding this for a treatment group.
Yeah, there were two groups where one group your add-on therapy was given
Yes,
and
sir.
another
Yes,
group
sir.
where add-on therapy was not given, right?
Yes, sir. Yes, sir.
You're comparing between these two groups, one control group and a study group, right?
Yes, sir. Yes, sir.
What was the statistical method that was adopted in assessing the efficacy apart from mean value?
Apart from mean value, we assessed only mean value by statistical. There's signs and symptoms and questionnaires we were done, no, sir.
Then how you can justify your like efficacy of your study, this treatment protocol, unless having
Based
a
on the mean value, sir.
no, you can't do it with only mean value. How can you say that your add-on therapy had a better efficacy unless you apply a statistical method?
Statistical measures were carried out like SSPS and using that, sir.
No, no, no. Which test you have applied? There are
Pair
so many
T,
tests,
yes,
right?
yes, sir. Independent between the groups, it was independent T test, and within the group, it was pair T test,
Yeah,
sir.
but you have not presented any data of t-test or pair t-test in
In
your
methodology, I
presentation.
mentioned the statistical analysis, like what and all test we incorporated that, sir.
But
But
results
as
were not presented, appa.
sir, it is like
Results were not presented here.
uh, it is bit agree, sir. But for the time being, I presented this much.
Okay, okay, leave it. And you said that Yashtimadu Kwata Parisheka was done
Yes, sir.
and followed by Shatadutagrita application, right?
Yes, sir.
But Shatadutagrita was started from sixth day, whereas Yashtimadu Kwata was done from beginning.
Yes, sir.
Why?
Yes, sir. Agree to the question. Like in the first day, was the chemotherapy was done 6 days, and when standard of care, what they are taking care, sir, in that hospital.
Okay.
Shadadauta Gurta was external therapy where the signs and symptoms are not that much exhibited, and there was no burning sensation in some patients. Not all the conditions where to maintain the equality, it was started from sixth day where all the patients when they starts exhibiting the symptoms, from that day it was done, sir.
Okay.
From the first day only, the signs and symptoms were not exhibited by the patients. They are not feeling burning pain and all, sir.
But you heard the Parisheka was started from first day itself, right?
Yes, sir. It was like it is Shita Guna as a temperature of 15 minutes. In that, in IPD, we were not allowed to give. Once the patients was out of this chemotherapy wards, we are started our work.
Okay. But the final efficacy was taken of combined effect, right? You are not assessed separately about
Yes, sir.
Seka and
No, sir.
Grita.
No, sir. Combined results.
Okay, okay. Madhukeshwar, sir.
Yes, sir. So I have only one question. How many patients this study is tried?
Sir, 22 patients were included.
22 patients.
Yes, sir.
So statistical methods, which is 22 patients, that data if would have kept means we would have give a conclusion, better conclusion regarding the efficacy.
Agreed, sir. But the mean value is sufficient, I thought, sir. Time being, it was very difficult for me to conclude this whole topic in a 5 minute, actually.
Yeah, because p-value itself will say that which test is applied. Based on that, p-value
Sir,
itself says
in the
that.
p-value, in the conclusion part, I have, sir, sorry, in a conclusion part, I kept like p-value is more than 0.05 was the result. Significant incidence by concluding everything, p-value was more than 0.05.
Okay, thank you, sir.
Thank you. Now let's move on to the next presentation. Next presenter is Dr. Vaishnavi B.R. from Ayurveda Mahavidyalaya, Hubballi. Title of the presentation is Classical Formulations in Cosmetology and Trichology, a comprehensive review from traditional text. Dr. Manojas, are you ready?
Yes, ma'am.
Can you share the screen? The next participant is Manojas Ambrad from Sri Sri College of Ayurvedic Science and Research. Title of the presentation is Management of Kalitya with Bringaraja Taila Nasya, a case series. You can start.
Hello, madam.
Yes.
Hello, can I audible, ma'am?
Yeah, you are audible.
Good evening, everyone. Myself, Dr. Manas from first year PG Scholar Department of Kaya Chikitsa, Sri Sri College of Ayurveda, Bengaluru. My topic is Management of Kalitya with Bungaraja Taila Nasa as a case series. Introduction. Kalitya is common disease in present era associated with unhealthy diet and lifestyle. Somewhere are using like different type of shampoos and oils will that due to that more airfall condition is going to be happen. Treatment part is Nasya Karma. Nasya is one of the Panchakarma procedure which elevated the vitiated dosha, and also it is helped in eliminating morbid dosha resulting here. And there is the case study taken for the as a case series. Case report. The case series include 5 patients who visited to the OPD of Sri Sri College of Ayurveda College and the hospital Bengaluru with primary complaints of airfall associated with dandruff and itching of scalp. Cases that were evaluated initially include the history and physical examination with grading based on assessment parameter. Demographic data collected include age, gender, and personal and medical history with duration since onset of the conditions. This is the assessment parameter where Kalitya grading as 0 with absence of airfall, occasionally with graded as 1, moderate loss with 2 grade, maximum loss with 3 grade. Next is Dharunaka. 0 considered for absence of dandruff, mild graded as 1, moderate graded as 2, severe as graded as 3. Uh, Shirokandu. Can I audible, ma'am? Hello.
Yes, please continue.
Yeah, Shirokandu with absence of zero grading, mild graded as 1, moderate graded as 2, severe graded as 3. The condition of next is diagnosis based on condition of patient who are diagnosed as Kalitya on basis of Nidana, Lakshana, history and the assessment parameter. No other investigations for these cases. Materials and methods. Literature of all Ayurvedic texts, modern medicine literatures and new research published are studied for 3 works. Aims and objective to evaluate the efficacy of Bungarajan Taila in Kalitya. Case is done in Sri Sri College of Ayurveda College Hospital. Treatment intervention Shiro Abhyanga with Bungaraja Taila, that is for 30 minutes. Nasya Karma with Bungaraja Taila 8 drops in each nostril for 7 days. Treatment outcomes before treatment and after treatment. In first Kalitya, first case it is pointed with 3, more number of airfall. After treatment it is ratio as 1, and Chirokandu is 3, and after treatment is 1, and Darunaka is 3, and after treatment is 0. And in case 2, Kalitya is 3, means more number of airfalls. After treatment graded as 1, less number. As you will say, ma'am, this case series will be this box will be explaining about the assessment parameters about 5 patients. Discussion. Airfall of alopecia has been described in Ayurvedic as Kalitya. Acharya Charaka and Acharya Vagbhata have included Kalitya in Shiro Roga. Whereas in Sushruta Samhita, Ashtanga Sangraha, Madhava Nidana and Yoga Ratnakara has included Kalitya under Shudra Roga. Before Nasya Karma as a Purva Karma, Shiro Abhyanga was done 30 minutes with Brungaraja Taila, which decreases the Rukshata of Kapala improves local blood circulation, does Shrota Mukha Vishodhana, and exaltate Prakrita dosha. Bhungaraja Taila has Lagu, Shukshma, Tikshna, Snigdha properties and it was prepared with Kesha drugs. It acts on Pitta dosha, which is a main causative factor of Kalitya. The obstruction of the Shrotas will also clear by Shukshma. Shukshma and Shrotagni properties, which leads to growth of air. Mode of action of Nasya Karma in Kalitya. Nasya gateway of Shiras. The drug administered through nose reaches the brain, eliminates wound morbid doses responsible for the diseases. Nasya is decreased as the gateway of Shiras, hence the drug is administered through nostril. The drug thus administered reaches the Shringataka Marma and Shringataka Marma spreads in the Mudu, reaching the Marma of Netra, Shrota, Kanta, Shramukha. This helps in contracting the pathology of Kalitya by vitiating the Vatadi doshas, thereby imparting the Bala of Shiras and Kapala. Also in proper regulation of blood flow for healthy growth of hair. Conclusion. Kalitya can be manifested as primary disease as well as secondary to the disorders or can be present as system of many diseases having different causative factors. Shirobhanga being one of the Mudini Taila helps in Vata Shamaka, preventing the airfall by strengthening of hair follicles and scalp. Nasya Karma nourishes the shrotas present above the clavicle, including the hair follicles, which strengthens the hair and reduce hair falling. The case series shows the successful management of case of Kalitya. The above said Shiro Abhenga and Nasya Karma with Bhungaraja Taila was found as safe and effective. Thank you.
Thank you. Now I request judges to ask questions.
Dr. Manoj.
Yes, sir.
Yeah. In the presentation, maybe the last but one slide, you have been highlighting about the effect of Nasya.
Yes, sir.
And the contents were totally about the efficacy of Nasya. And there is no role for Brangaraja Taila in the efficacy. It's only related with Nasya. So looking into that, I feel that any Taila or anything can be used for Nasya. There is no significance for Brangaraja Taila.
Okay.
What is your opinion?
But it is taken for. Hello?
Yeah. You are audible.
This is taken for only 5 patients from myself, sir. Whether this is be acting without giving any extra medications, only Nasya is been done for this case, sir.
Yeah, that's what I'm telling. You are highlighting the efficacy of Nasya, but you have done Nasya with Brangaraja Taila, right?
Yes, sir.
Yeah, there is no importance for Brangaraja Taila in your discussion. Your total discussion is focused on efficacy of Nasya.
Okay, sir.
By that, I feel that any Taila can be used. There is no need of specifically using Brangaraja Taila. What do you say?
Due to it is Tikshnata of mode of actions of drugs, sir. It consists of Madhura Tikta Kashaya Amla Rasa, sir, mainly. And gunas like Guru, Shita and Guru, Shita Guna, sir. Alternatively compared to Guru Guna is compared to Guru is more, sir, rather than Shita. Ushna and Shita Virya, Ushna is having 60%, sir. Shita is having 40%. Here Ushna acts more, sir.
Yeah, but in your discussion, you have not highlighted any of these things. You have just highlighted the efficacy of Nasya.
Yes.
Okay, leave it. You have used some assessment parameters which you graded 1, 2, 3. Okay, like what is the reference for this parameter? Whether it is in any international classification of diseases (ICD) or it's your own assessment parameter, or whether any standard parameters available? Have you searched for?
No, sir. This is done by self-assessment, sir.
Yeah. Have you ever tried to like find out whether there are any standard grading parameters for hair fall? Grading
Great.
0, 1, 2, 3 or
For that. So,
no?
no, sir.
Okay. And you have selected 5 patients, right? And
Yes, sir.
you have not presented any demographic data of these patients. What was their prakriti? What was their age? And like
Age is in between 18 to 30 years, sir.
18 to 30.
Because
Okay.
sir.
Prakriti?
In this condition, all male patients are users.
Okay.
And they excluded hypertension and type 2 diabetic patients are excluded for this study, sir.
Okay. Prakriti?
Pitta Vata Prakriti.
With all 5 patients.
Sir.
Okay. Okay. Over to you, sir. Madhukeshwar, sir.
I have only one question.
Yes, sir.
In the patient selection one,
Sir.
Khalitya, there is as per there is only one disease is explained, but in that subtype is also is explained. That is Indralupta, Khalitya, Rujya. That is Rujya also is explained. So based on
Sir.
that, can be correlated to alopecia areata, alopecia totalis, alopecia universalis, and androgenic alopecia. So these
Hello.
whether these 5 patients are there, in which group it will come? In alopecia areata, whether alopecia totalis or alopecia any, which group they are coming?
Sir, and androgenetic alopecia and alopecia areata in these two conditions were used.
Androgenic alopecia and alopecia areata. Okay. Okay, thank you.
Thank you, sir.
Thank you. Now we will move on to the next presentation. Dr. J. Kaveri Abhinaya from Sushruta Ayurveda Medical College and Hospital, Bangalore. Title of the presentation is Efficacy of Datturati Taila in Kalitya.
Yes, ma'am.
Can you please share your screen?
Yes, ma'am. Yes, ma'am. Uh, Good evening, respected organizers. I'm myself, Dr. J. Kaveri Abhinaya, first year PG scholar, Department of Kai Chikitsa, SMCH, Bangalore. Introduction. It has Kalitya has been described in Ayurveda under the heading of Kshudra Roga, Shira Roga by Acharya Sushruta and Vagbata. It is actually mainly predominant of Tridosha Vyadhi. According to contemporary sciences, it is termed as Talogan effluvium, which means compared as like partial or complete loss of hair. It is a minor disease affecting approximately 85% of the old population. It is most common cosmetic condition in both young and old age, irrespective of gender. The people who have stress along with indiscriminate dietary habits, which reflects directly to the loss of hair. So this Kalitya can be managed with modifying lifestyle and purification therapy from Ayurveda. So, according to Sushruta, Kalitya, he has been explained uh, uh, because of accumulation of pitta dosha, provocating of pitta dosha. Uh, because of provocating of pitta dosha, Romakupa, it stops, blocks the hair growing. So, according to Vagbata, according to Ashtanga Hridaya, there are types of Kalitya like Vataja, Pittaja, Kaphaja, and Jitoshaja Kalitya. So here the pathogenesis was because of Pitta provocates by its own factors. The aggravated Pitta along with Vata lodging in hair roots, and the Kapha with Rakta abstracts the Romakupa. So the involvement of all the three doshas which leads to Kalitya. So in contemporary sciences, Kalitya is termed as can be termed as a Talagan effluvium. So here typically present with hair shedding and with a relatively abrupt onset. So they are acute and chronic loss of hair. In acute loss of hair, it lasts less than 6 months. In chronic, it lasts for up to 12 months. Causes can be due to hormonal conditions like hypothyroidism, chronic metabolic illness, or iron deficiency. So investigations can be done in this hair pull test, CBC, ferritin test, hair cost. These tests can be done to know about the whether about Kalithiya disease. So the management part, in according to contemporary sciences, is minoxidil topical solution, hair prosthesis, hair transplantation, and hair cosmetics. By using these therapies, there can be many side effects like acne of site in the site of application, burning of scalp, inflammation, soreness of root of hair, etc. So in Ayurveda, according to Chakradatta, in Sahasra Yoga, they mentioned about Daturadi Taila can be used in Kalitya. So here the ingredients are Datura Patra Swarasa, Taila Dravya. Taila Dravya is Muchita Tila Taila and Kalka Dravya is Datura Bija. So here the method of preparation, mode of action of Daturadi Taila is Rasapradana Tikta Katu. Gunapradana is Lagu Ruksha Vyavaya and Vikasi. Doshagnata is Kapha Vata Shamaka. Ushna Virya and Katu Prabhava Vipaka. So it is Vata Vikara, Rogagnata is Vata Vikara. The plant contains different functional groups such as tannins, steroids, alkaloids, flavonoids, and glycosides. Atropine and scopolamine are competitive antagonistics of muscarinic cholinergic receptors and are central nervous system depressants. So the method of preparation of Daturadi Taila is preparation of the prepare the kalka of Datura Bija and mix it with Taila and Datura Patra Swarasa should be taken in a stainless steel vessel. It should be subjected to the heating process till it remains the quantity of Muchita Tila Taila. After the completion of the process, it should be filtered and stored in the glass bottles. So the method of use Daturadi Taila is Shiro Abhyanga. By doing Shiro Abhyanga, benefits of Shiro Abhyanga is it improves, it moisturizes the scalp and improves hair growth. So it can be performed at any time of the day. Smearing the prescribed oil uh, by doing Grashana Hasta, Mridvangali Tadana, Dvihasta Tadana, and Taranga Hasta. Conclusion: in this era, most Kalitya is not considered as a disease. It is actually a symptom of many diseases. So in Ayurvedic sciences, various medicated hair oils have been described for Kalitya. In this attempt has been made to collect all the research works that studied in the role of Shiro Abhyanga with Daturadi Tailas used in Kalitya. I have seen some of the articles. There is more beneficial effect in Daturadi Taila comparing to other Tailas like Bringraji Taila, like etc. So Daturadi Taila is giving more efficacy in Kalitya conditions. So in the present era, choosing other cosmetic therapies which leads to side effects can get solutions from the Ayurveda medicine with more benefits. Thank you.
Thank you. I request judges to ask questions.
Dr. Kaveri, please put
Sir.
your title slide.
Sir.
Yeah, again, I was telling the same thing for some other presenter in the beginning. The title shows efficacy of Daturadi Taila in Kalitya.
Yes, sir.
Looks for me like a clinical study done by you to evaluate the efficacy of Daturadi Taila in Kalitya. But in the contents of your presentation, nowhere there is a clinical data that is being presented, right?
Yes, sir. Yes.
Yeah. So I suggest you that when you frame a title, you frame the title according to the contents of your presentation. Don't simply
Yes.
give a title. Give a title which suits to the contents of your presentation. Okay.
Yes, sir.
And the next one, the conclusion, last slide.
Sir.
Last slide.
Yes, sir.
In the conclusion, see the second point you are telling in this an attempt has been made to collect all the research works that studied role of Shirobhenga with Datturadi Taila. Okay. And
Yes, sir.
I did not find any research data that has been presented on Datturadi Taila done by anybody.
Sir, actually, I have searched some articles. They have did a comparative study in Datturadi Taila and some other Tailas.
Then you should give it in the contents of your presentation. You have directly given it in the conclusion, and in the content of your presentation, nowhere any research data has been discussed.
Sir.
Okay. And you have been telling about Doshagnata, you are telling Kapavata Shamakam, and then
Yes.
you are telling that it is Vataharam. Which one I should believe?
Sir, actually, most predominantly is Pitta will be provoked, sir.
Yeah, yeah. But you are telling Doshagnata Kapavata Shamakam, and then somewhere you are telling it is acting upon Vata Vikaram. And you are telling the Kalita is because of Tridosha. And there is in your own statements, there are controversies. They are not related to each other. You have prepared this Thailam? Datturadi Thailam?
Sir, no, sir.
No. Okay. Yes. Over to you, sir. Madhukeshwar, sir.
So only one question is there. So the Datturadi Taila, it's in your conclusion it is says that Datturadi Taila is release stress, promotes the hair growth and helps in scalp disease like it is mentioned. But Dattura is since it is one of the Vishadravya, one of the ingredient is atropine. So instead of relieving the stress and all, it acts as a minoxidil-like content. Minoxidil is a peripheral vasodilator. So similar effect will be there. By that, it will it increases the blood circulation surrounding the scalp area, and thereby it helps for regrowing of the hair and it is active. So stress reliever and all it won't act.
Okay, sir.
Okay. Thank you, sir. Thank you.
Thank you, sir.
Thank you. Now we will move on to the next presenter, Dr. Tejaswini Hiremat from Ashwini Ayurvedic Medical College and PG Center, Davangere. Title of the presentation is Importance of Karanja in Various Skin Conditions.
Good evening, everyone. Myself, Dr. Tejaswini Hiremat. I'm from I'm PG scholar,
Excuse me,
first
ma'am.
year PG
Please can you
scholar.
rotate your screen?
Ma'am, yes, ma'am. Ma'am, is it okay? Ma'am, is it good to go now?
Yes, yes.
Okay. So I am first year PG scholar from surgery department. So my topic is importance of Karanja in various skin disorders. Introduction. In Ayurveda, Twak is described as Upadhatu of Mamsadhatu. According to Acharya Charaka, Twak has 6 layers. According to Acharya Sushruta and Sharangadhara, 7 layers. 7 layers of skin, namely Avabhasini, Lohita, Shweta, Tamra, Vedini, Rohini, and Mamsadhara. Total 166 skin diseases are described as Brahatrai under vast heading of Kushta and Kshudra Roga. So my medicine is Karanja to treat various skin diseases. So definition, त्वचि दोषः प्रकृत्यांति त्वचा दोषः सन्निपाततः रक्तं मांस च संधूयल ततो विकारं प्रचक्षते. So nidana, because whatever medicine we give, without nidana parivarjana, everything is waste according to Acharya Sushruta and Charaka. So it is important for to nidana parivarjana. So in dietary factor, what are the nidanas? Are dietary factor, composition of consumption of incompatible foods, intake of sour, salty, pungent foods, and intake of stale, contaminated food. Sometimes patients doesn't know that viruddha ahara can act mainly in skin disorders. Viruddha ahara is like fish with milk and jambu with milk, etc. And excess amount of salt in food, and some people add extra salt in their food, which also cause skin diseases. So lifestyle, irregular eating habits, lack of personal hygiene is very important in skin diseases due to heavy exposure in sunlight and cold, also can affect in skin diseases. And environmental factors, exposure to pollens, allergens, and infectious agents. Example, in Karnataka we call it as kori hula, which has very stings like structures on their body, which can cause skin disease. And also some other like honeybees, their sting also also causes the skin disease. So samprapti doshah prakupitah sarve tvak gachanti sannipatat raktam mamsa cha sanduyatato vikara prachakshate. Nidana sevana leads to vitiation of doshas. These vitiated doshas affect the skin or other tissues, causing various disorders. Involvement of multiple tissues and doshas makes treatment complicated and require clinical approach for treatment. Rupas, discoloration of skin, itching, burning, swelling, inflammation, formation of blisters, scaling, peeling, pain, tenderness, ulceration, and oozing in severe conditions. So, drug of choice is Karanja, taxonomy Pongemia pinnata, binomial name, and kingdom Plantae, family Fabaceae, genus Pongemia, species pinnata. So, Karanja has Katu and Tikta rasa. It's mainly important in skin diseases. Bacteria and fungus acts very prominently. So, to bacteria to hello, am I audible?
Yes,
Hello.
yes, you're audible. Continue.
Okay, ma'am. Katu and Tiktarasa mainly act as antibiotic, and Lagu and Ruksha because most of skin diseases are aggravated in wet conditions. The Karanja containing Lagu and Ruksha, so for it is very helpful to heal the wound, and Veera is Ushna. As you know, most of the skin diseases happen in winter seasons, especially fungal infections. So, ಅಯ್ಯೋ ಸ್ವಿಚ್ ಆಫ್ ಆಯ್ತು ಅಂದೆ.
Okay, we'll move on to the next presenter.
Yeah. Maybe her battery was very low and it is switched off.
Yes, so it was
And now
5%
better to move to the
remaining.
next presenter. Yeah.
Next
Please continue
presenter,
with the next presenter.
next presenter Eduri Mamata from Bierkar Government Ayurvedic College, Erangada, Hyderabad. Title of the presentation is A Critical Review of Trifalati Grita in the Management of Kalitya. Dr. Eduri, are you there? Dr. Prajul K. Edahalli, are you available?
Hello?
Yes, ma'am. You're audible. Can you share screen?
Okay, ma'am. Ma'am, is it visible?
Yes, it's visible.
Okay, thank you, ma'am. Oh. Good evening to all. Myself, Dr. Iduru Mamta from Dr. B.R. Care Government Ayurvedic College, PG Scholar, Department of Dravya Guna. I'm here to presenting critical review of Trifaladi Kruta in the management of Kalitya under guidance of guide, Dr. S. Babu Rao, Sir, Associate Professor, DG Department of.
Sorry to interrupt. Myself, Dr. Tejaswini. Sorry, I have poor network, so I was unable to connect. Can I continue my presentation, ma'am?
You can continue after this.
Okay, thank you, ma'am.
Ayurveda is a science of life in which not only systemic diseases but also minor diseases are described in detail. The concept of beauty is getting more attention globally, and hair plays an important role. Mm, it has been said that hair is a barometer of beauty. Healthy, long, and vibrant hair help a lot and improvement of personality. Hair fall is one of the minor disease affecting approximately 1.7 of percent of world population. Kalitya is a progressive disorder. People living in sedentary way of life, stress, dietary habits, and environmental factor results in many disturbances and deficiencies in the body, which directly reflect in the hair loss. According to Acharya Sharangadhara, scalp and body hair are upadhatu of Majjadhatu. Hair made up mainly Parthiya Mahabhuta. Hair formation start during 6th month of intrauterine ripe. Hair it's normal to shed between 50 to 100 hair for a day. More than 100 hair are considered to be a Kalitya dominant Tridoshaja Vadi, we can reduce the hair fall with Trifaladi Krutta. Origin of hair. Ayurveda mentioned the human body is made of main seven dhatu, Rasarakta, Mamsa, Medasti, Majja, Shukra, along with the production of latter dhatu. It is side by side production of Upadhatu, Mala is former dhatu. During process of production, the dhatu is when metabolism of Asti dhatu occurred by its own Agni, Majja dhatu emerges from the Sarapat, and at the same time, hair phases of hair growth. According to modern science, hair development undergoes a respective cycle in the scalp. Hair growth cycle has three essential phases: anagen, cartesian, telogen phases. This is the hair cycles. Anagen phases uh, two, 2 to 6 years active growth producing new cells. Catagen phase 2 to 4 weeks stop growing, detaching slowly. Telogen phase 3 to 6 months. Follicle will rest. And cycle will start again. Cycle start over. So anagen three phases here mentioned. Anagen due to anagen inflammation hormones increased stress of food nutrition medication, it will direct will come telogen without catagen directly. Causes of Kalitya Roga due to Ushna Guna Pitta Dosha involvement. Individual of Pitta Prakriti starts hair fall and graying of hair earlier than individual of other Dosha Prakriti. Excessive intake of salt. The hair has tendency to lose its natural color with advancing age. Although hair fall can be reduced by decrease in asti dhatu or visheshana pasti dhatu, as hair are formed by waste product of mala of asti dhatu. Hair depending upon it for nutrition. Excessive combing during ritual leads to hair fall, causes, according to modern science, a nutritional disorder, local skin disorder, endocrinal diseases, forced to acute illness, stress, drugs, cosmetic and genetic tendencies. Uh, age Age also one of the cause for hair fall. Cancer treatment. Hair loss is common side effect of cancer treatment, chemotherapy, radiation therapy, etc. Childbirth illness and or other stressors. After giving birth, hormones levels return to their pre-pregnancy levels. The drop in estrogen triggers your hair to go to back to the cycle growth. DHT affect your hairline by maintaining hair hormonal imbalance. Medication also causes for hair fall. Trifaladi Trifala Trifala Trikatu Draksha Maduka Kadurohani Prapondarica Vidanga Nagakesara Nilotpala Sari Sveta Sariva Krishna Sariva Chindana Haritra Daru Haridra, each one 12 grams Gruta, 750 ml Kshira, 750 ml Tripala Kwata, 2200.
Ma'am, time is up.
Okay. Conclusion. Kalitya is a wicked disease made for proper management. Some minor changes of lifestyle and dietary habits prevent the hair fall. Nidana Parivarjana is main role of preventing the hair fall.
Now I request judges to ask questions.
Dr. Mamata, please go to your title slide.
Okay, sir.
Your title says that critical review on Trifaladigrita
Yes,
in the
sir.
management of Kalitya. But the content, there was no critical review found. I did not find any critical review in the management of Kalitya in your presentation.
Okay.
So when you select a title, please select a title which is suitable to the content of your presentation.
Okay, sir.
And out of 10 slides, your first 7 slides were about the causative factors and pathogenesis of Kalitya.
Yes.
And last 2 slides, you had content about Trifaladigrita. So it is not a critical review on Trifaladigrita in the management of Kalitya.
Okay, sir.
And you should have made an attempt to effect of Trifaladigrita on Kalitya, whether it is on the causative factor of Kalitya, whether it is on the Samprati of Kalitya,
Okay.
or you were telling about 3 phases of hair growth, right?
Yes, sir.
In which phase of hair growth Trifaladigrita is useful. If you had included all this in your presentation, it would have been really a critical review.
Okay, sir.
Yeah, now it is not a critical review.
Okay.
Yes. Sir, over to you, sir. Madhukeshwar, sir.
Doctor, this study is completed or whether it is a review study?
Sir, review study only, sir.
Review study only. Yes. This testing and all this clinically it is not tested.
No, sir.
No. Okay. Because Trifaladigrita I have mentioned in the Nidana or this one Samprapti and all, which are all the different types of hair fall. It may be androgenic because of the nutrition deficiency and all. So
Yes.
in under these nutrition deficiency, androgenic and genetic hair falls and all, which hair fall Trifladigata will be useful?
Which hair fall?
What kind of hair fall Trifladigata will be useful?
Sir, repeat again, sir. I can't understand.
There are different types of hair fall reasons are there. Causative factors are there.
Yes.
In which type of causative factor Trifladigata is useful?
Sir, nutritional deficiency hair fall, sir.
But in the ingredient of the Trifladigata, there is no nutritional ingredient. Only one or two are there. But nutritional deficiency means because of any micronutrients and iron, all those things.
Yes, sir.
So, Trifladigata will be useful for what kind of hair fall?
Yes, sir.
Okay, sir. Thank you, sir.
Thank you, sir.
Thank you. Dr. Tejaswani, can you continue your presentation?
Yes, ma'am. I'm sharing my screen.
Continue from where you stopped.
Okay, ma'am. So I explained about Rasaguna, Virya, Vipaka, and Prabhava of Karanja. Now moving to useful parts of the plant. Seeds, oil of the Karanja has cosmetic and trichological properties like anti-inflammatory, antimicrobial, UV protection, moisturizing, wound healing, scalp health, hair growth, and medicinally it is applied on scabies, herpes, leukoderma, and cutaneous diseases treated with Karanja seeds. Karanja leaves and stem juice of Karanja medicinally used in cleaning of foul ulcers, which we use in our hospital mainly, and gonorrhea, flat ulcer, beriberi, and leprosy. Especially for wound healing, we use Karanja leaves and stem juice. Other uses of Karanja is blood purification, digestive health improvement, antioxidant, and anti-cancerous properties. So various formulations of karanja, for internal uses, karanja powder, karanja capsules, karanja juice, and karanja grata. Which will be helpful for various diseases. According to that, we use internal medicine, and for external application, mainly karanja oil, 6C ointment, which is available in market, which contain Karanja Taila, Gandhaka, Yashoda. The Himalaya Herbal Karanja Cream and Biotic Bio Karanja Anti-Acne Cream, which is mainly used for Yavana Pidika. And these two are my case studies, which are done in Chikteri Ayush Wing, which is government hospital in Davangere. So the various patients we see daily, we see various patients of skin diseases. I have taken mainly two patients. So one is Narayana V Joshi, age of 58 years. He has complaint of wound over left leg below knee, pain, sometime discharge and bleeding on scraping. This is from 2 months, and he has history of diabetes mellitus since 10 years. On examination, first day we found that the wound is wet because of scraping, scratching, and the wound location is left leg below knee. Slightly bleeding was there. So we diagnosed it as Dushtavrana. First we used Triphaladi Kwata Churna for washing of the affected area, and then we applied Karanja Taila along with Vedic healing oil every alternate day. And for controlling diabetes mellitus, we gave him Nishamalaki tablet and Karanja Churna internal use, we used 5 grams 5 grams daily morning and night with water, warm water after food. So result, patient is asked to follow up on every week. First we asked him to follow up daily for dressing. After 15 days, we asked him to prepare. We teached him to prepare his own Tripaladi Churna Kwata, and we teach him to how to apply Karanja Taila. So now we are following the patient on every week. The wound is now the wound recovered up to 60%. So the second case is name of the patient is Kavita VH, and she is 35 years old. Her main complaints are severe itching, redness over right arm, back region, and bilateral thigh region since 1 month. Because of because of the season and the moist air, these fungal patients are very high in daily basis. So she has no history of diabetes mellitus or hypertension. She is on no any other medications. So on examination we found round eruptions, redness over affected area, so we diagnosed it as dadru. So we started using 6C ointment, which is available in market, which contain Karanja oil, Shuddha Gandhaka, Shuddha Yashada Basma for local application. Karanja Churna with warm water 5 grams morning and night, and Gandhaka Rasayana 1 BD, and Triphala Churna for washing the affected area before applying the ointment. So patient is asked to follow up every week and take medicine up to 2 months. Patient got complete cure, recover if after 2 months. So thank you. This is my presentation about Karanja in various skin diseases.
Thank you. Now I request judges to ask questions.
Yeah, Dr. Tejaswini, in two case studies which you have presented, you had multiple medications. You had Gandhakrasayana in both cases, and you
Yes, sir.
had Palatrika Dikwata Prakshalana in first case, and you had also Nishamlaki tablet
Yes,
which
sir.
is given in the first case. And how do you relate the efficacy of treatment
Mhm.
to only to Karanja?
So actually, what I have did is, I haven't applied Karanja oil, or I haven't given Karanja Churna for first few patients, and then for second half patients I have given Churna and local application of oil. So I found that it accelerates the wound healing and curing of the skin diseases.
Then you should have presented a comparative data of the group
Okay.
where Karanja Taila was not applied and a group where Karanja Taila was applied, and then comparative or like what you call results if you were presented, then you would
Oh,
have
yes, sir.
appreciated it better than the
Uh,
presentation you have done now.
of
And
course.
have you any references in Nigantu saying that Karanja have efficacy on skin diseases or Vrana?
So I have referred Sharangatara Samhita and Sushruta Samhita mainly. So I found in Sharangatara Samhita that the what Karanja having Ruksha Guna and Tikta Rasa.
My question is whether you have any reference about the efficacy of Karanja on skin
uh,
diseases or on Vrana in any Nigantus.
so for now, I haven't recorded any references, but definitely I have read about
No,
the.
doctor, you are presenting on importance of Karanja on some skin
Yes,
diseases.
sir.
Then
Yes, sir.
definitely you should have referred some Nigantus or
Yes, sir.
Samhitas where Karanja has been mentioned as Kushtagnam, Vranagnam, or
Yes, sir.
something of
Yes, sir.
related with that.
Yes.
You have not made any attempt to collect information about the properties of Karanja?
Yes, actually, I have concentrated more on practical cases, so I might fail to record the references of Karanja, but definitely I have read it, but I haven't mentioned it in my PPT. I apologize for that, sir.
Okay, oh, no need of apologizing. Like when you are
Okay.
presenting on Karanja, you should have
Yes, sir.
collected some information about
Of course, sir.
the Dravyaguna aspect of Karanja. And
Yes,
do
sir.
you know, doctor, how to prepare Karanja Taila?
Sir, Karanja Taila, actually, we bought it from various pharma companies, sir.
Okay. So
Yes,
you
sir.
cannot prepared it.
No, sir. Practically, I haven't prepared Karanja Taila.
Okay.
Yes.
Okay, doctor. I have one. I don't have a question now. I have a suggestion for you.
Yeah. Okay,
Probably
sir.
in the beginning you were telling you probably introduced yourself as a PG scholar from surgery department.
Yes, sir. Yes, sir.
Yeah. Don't hesitate to say that you are from Shailajantra department.
Of course, sir. So
Okay.
I
And
apologize for that.
all the shlokas which you have given in your slides, you better use Devanagari script than typing it in English.
Okay, sir. Okay, sir.
Yeah.
Okay.
Thank you, sir. Thank you,
Thank you
madam.
so
Sorry.
much.
Yeah.
Thank you so much, sir.
Yes. So I don't have any question. Just one. This one is whatever the market sample which is Karanja you have taken means. So which
Yes, sir.
company you have taken it?
Sir, we have taken from Multani company and Vaidyanath company, sir.
Baidyanath company.
Yes.
Okay. No more questions. No.
Oh, thank you. Thank you so much.
Thank you. Now we will move on to next presentation. Dr. Prajwal K. Yadahalli from Jagadguru Gavisiddeshwara Ayurvedic Medical College. Title of the presentation is Review of Cosmeticals Mentioned in Ayurveda.
Hello, madam. Namaste. Hello.
Yes, you're audible.
Hello. My screen is sharing, ma'am.
Yes, visible and you're audible. You can start.
Good evening, everybody. Myself, Dr. Prajwal K. from Gavisiddeshwara Ayurvedic Medical College, Koppal. I am first year PG scholar from Department of Rashastra and Vaishajya Kalpana. My presentation is on review of cosmeceuticals mentioned in Ayurveda. Introduction. Cosmeceuticals are the products used for improving or for retaining the beauty that are mainly employed for curing health of skin, hair, tooth, and eye. The use of cosmetics was not only directed for developing an attractive external appearance, but towards achieving longevity with good health. Ayurveda cosmeceutical provides one Vayastapana, Varnya, Tvacha, Shotara, and Tvachagni effects, thus helps in retaining beauty and resists symptoms of early aging. Review of classical literature reveals that beautiful appearance is natural since the time immortal, and diseases affecting the beauty were treated vigorously. The presence of chemicals such as essential oils, alkaloids, proteins, flavonoids, vitamins, and minerals contributed toward the cosmeceutical properties of herbal cosmetics. Methods. Cosmetics explained in Ayurveda. The reference of cosmetics can be found in Ayurveda in terms of Rana, Varnya, Tvacha, and Keshya. Charaka Samhita Sutrasthana, Shat Virechaniya Shastri Adhyaya explained Varnya Dashamani, and in Shushruta Sutrasthana, we consist of Lodradi Gana and Eladi Gana. Ashtanga Hridaya in Varnya Dravyas were explained in Lodradi Gana. Different nigantus are also explained the Varnya Kesha Tvacha Dravyas. Those are Bhava Prakasha Nigantu, Kaya Deva Nigantu, Dhanvantari, Madha Nigantu, and Raja Nigantu. Varnya Mahakashayana Varga consists of Chandana, Tuga, Padmaka, Ushira, Madhuka, Manjishta, Sariva, Payasa, Shita, and Lata. And Lodra Digana comprises of Lodra, Savara, Lodra, and Palasha, Kudanna, Panji, Katpala, Yolaku, Shalaki, and Jin Kadamba, Shala, and Kadali, which has karma of Varanya, Stambana, Meda, and Kafara. Ela Digana consists of Ela, Tara, Kushta, Mamse, Damyaka, Tvak, Patra, Nagapushpa, Priyangu, Arenaka, Vyagranaka, and Shunti, Chandana, etc. It has karma of Vata and Kapha, Shamaka, and Varna, Prasadaka. Cosmetics related yogas mentioned in Vaishajya Ratnavali, like related to Kesha, that is Palitya, that is Naradilepa, and Brungaraja Taila. Whereas in Kesha Ranjaka yogas like Trifaladi Lepa and Brungaraja Pushpa Lepas. In case of Dharunaka, like Mashadi Lepa and Nilotpaladi Lepa, and cosmetics related to Varna like Mukha Kanti Karavardaka yogas like Mukha Kanti Lepa, Aritakyadi Pralepa, and Tarunya Pida Lepa, and Vyanga Hara Lepa. And yogas related to Tvak like Sharira Daurgandhya Hara yogas like Pradeya, made up of Abhaya, Tejapatra, Agaru, Jala, with Shweta Chandana Bhavana to form Lepa, and Arataladi Yoga and Daurgandhya Hara yogas. And in Vipadika Hara yogas like Sarjadi Malahara and Tila Kusmadi Lepa and Sarja Prasadi Lepa. And Loma Shatana yogas like Shuddha Aratala, then Mardana with Ushna Jala used in the form of Lepa, and in Palasakshara and Kadali Kandakshara with Aratala in equal parts, done Mardana with Kadali Kanda Jala used as Lepa. In like Aratala, Shanka, 1 part, Shanka Basma, 5 parts, Palasakshara, 6 parts, all given with Kadali Patra Faras Bhavana used as Lepa. In Aragwadadi Taila and Kshara Taila. And cosmetology in surgical practices like for Pandu Karma, that is for whitening measures of scar hyperpigmentation, Balataka Taila prepared by Hada Patana Yantra, and Basmas of domestic animals were used in the form of labor externally. For Krishna Karma, that is for hypopigmentation, Rohini Pala kept in goat's milk for 7 days and made a paste by goat milk is used for external application. For Roma Sanjanana, that is Astidantamasi and Rasanjana and goat milk made into paste used as lepa. For Roma Shatana, Shanka Basma and Artala triturated with kanji and used for external application. Results, various ganas are mentioned specifying Varna Karma of those groups such as Varna Mashaka, Varna Mahakasha by Charaka Samhita and Ashtanga Sangra, Lodradi and Elagana by Shushruta Samhita and Ashtanga Hridaya and Ashtanga Sangra. As we come across different yogas explained in Vaishajya Ratnavali regarding cosmetic aspects, as Vaishajya Ratnavali is a compiled textbook, most of the yogas found in Vrihatrayi, Laghutrayi related to cosmetic aspects are found in this book also. Our classical yogas are meant mainly for therapeutic functions. In addition to that, there is also cosmetic benefits. This itself is the advantage of classical cosmetic yogas over modern medicines. Discussion, most of the reviewed yogas here can be compared to cosmeceutical in Ayurveda, as it can provide cosmetic as well as medicinal benefits. Cosmetic has a great importance in day-to-day life of human beings.
Sir,
It
time is
helps.
up. Please conclude.
In this way, the cosmetics mentioned in Ayurveda are more beneficial when compared to the modern cosmetics. Thank you.
Now I request judges to ask questions.
Dr. Prajwal, have you come across any research works that have been done on any
Sir,
of the formulations which you have mentioned in your presentation?
Sir, Mukha Kantikara Lepa is my senior is doing a research work on it, sir. Pharmaceutical analytical studies going.
Okay, that is one. You have presented about so many formulations, so many drugs which have what you call cosmeceutical effect, right?
Sir.
You have collected from Charaka, you have collected from Sushruta, you have collected from Vaishij Ratnavali, and you have like so many formulations you spoke about in your presentation. Have you made an attempt to collect any research work related with any of these formulations?
Sir, one of the formulation research work is taken by my senior, sir.
Yeah, that's any other formulation.
Sir, this Trifaladi Lepa one research work is going done by our third year senior, sir.
Okay. You don't know any other research works done in other centers apart from your seniors?
No, sir, I didn't read, sir.
Okay. Have you gone through an article written by Dr. Aditi Gandhi and one under the guidance of Dr. Prakash Hegde? He has written an article on cosmeceutics in Ayurveda, cosmetology in Ayurveda. Have you gone through that article?
No, sir.
No, because most of the contents in your presentation, what I feel, are as given in that article. That's why I just was asking about that. And if you have taken any content from that article, then you should duly acknowledge in your acknowledgements. Okay?
Sir.
Yes, sir. Madhukeshwar, sir.
I have only one question. Among these many different formulations which is mentioned in the Samhita, how many are available in market? Whether that review is done?
Sir, when it comes to Taila Varga Bringaraja Taila, sir, and this Ariteke, the Pralepa is available, sir. And other thing I didn't search.
So why I asked means, so we go on mention the Hasdantamasi in every research, every slides and all. Everywhere in the presentation we mention it is not at all possible at all. It is not at all possible. And because if you want to make Hasdantamasi means we need to take permission from the forest official to use the Hasdanta itself. That's what. So which is available in the market, we have to look onto such formulations. It will be better. Thank you.
Thank you.
Thank you. Now we will move on to next presentation. Dr. Vasundhara S. from JSS Ayurveda Medical College and Hospital. Title of the presentation is A Bird's Eye View on Kalpanas for Loma Shatana.
Ma'am, is it visible? Hello. Ma'am, are my slides visible?
Yes, visible.
Hello.
Yes, doctor. Please continue. Yes, your slides are visible.
Okay. Om Shri Gurubhyo Namaha. Namaste all. Myself, Dr. Vasundhara S., first year PG scholar from the Department of RSBK, JSS AMC Mysuru, under the guidance Dr. Rajendra Prasad ML, Associate Professor from the Department of RSBK. Coming to the contents of the presentation will be based on the Shastrartha review of all the Kalpanas of Loma Shatana which are available in the Samhitas in the IMRAD format. Coming to the introduction, cosmetology and trichology, they are the old age concepts in Ayurveda. Like unlike contemporary sciences, Ayurveda has explained different terms for the hair based on the region it is present. For example, Kesha for the scalp hair, Loma or Roma for the body hair, Vyanjana for the hair which is present in the genitalia, etc. So, derivation is Luyate Kudyate iti. Sharirasya Keshaha, that is, Loma refers to Sharirasya Kesha and Shatana refers to Vinashana. So, destruction of the body hair is called as Loma Shatana. need for the Lomashatana is Lomashatana was used as a preoperative procedures for any surgery, but its importance in cosmetic purpose was very little. And also, women of that age, of that generation, were not prone to much of the body hair or the facial hair like how our parents or grandparents do. But nowadays, due to the various environmental causes, lifestyle disorders, excessive facial hair and the body hair is evidently seen in many women, which is leading to the humiliation and for lowering their self confidence. And also, we have seen many incidents where a high school girl who was topped in her exams also was insulted and humiliated throughout for her facial hair in the social media. So, all this somewhere will affect our self confidence and the self esteem of the people. So, Lomashatana is one such concept which is selected to remove all this such social stigma to increase the confidence in the women to present themselves boldly in the society. Objectives of this presentation are to compile all the formulations on Lomashatana and to know the probable mode of action of the formulations and to know its efficacy on Lomashatana. Coming to the methodology, the first reference of the Lomashatana Kalpanas can be seen in the Garuda Purana, and there are also many other references. According to Garuda Purana, it is Haratala Adi Churna, where main ingredient is a Haratala, and Haratala Adi Lavana Yoga, and Sudhadi Yoga, and Ballatakadi Yoga. And according to Charaka, where it is mentioned that Shami Phala is considered, or the Shami Bija Churna is considered as the best Keshagna. And according to Sharangadara Samhita, Haratala the Yoga 1, where it is Shankabhasma, Shuddha Haratala, Manashila, and Sarjak Shara, which are made into a paste. And Haratala the Yoga 2, where Haratala, Shankabhasma, Palashak Shara, Arkapatarasa, Kadali Dhandarasa are made in the form of lepa. And Karaviradi Thaila, where Karavira Patra, Chitrakamula, Danti Mula, Trivrit, Koshataki Phala, and Kadalik Shara, where Thaila is prepared from these ingredients. And next is, according to Vangasena, where the Lepa Yogas are using Shanka and Haratala, and using Kusumba Thaila and Snuhik Shira, and Haratala, Shankachurna, and Palasa Basma. And Thaila Yogas are Shami Bijadi Thaila, Karaviradya Thaila, and Karpuradya Thaila. According to Sushruta, manually he has mentioned that plucking of the hair with kartari or sandam shayantra, like tweezing of nowadays, which is used, and application of lepa. Lepas are Shami Bija the yoga, where Shami Bija, Saindava Lavana, Dirgha Vranta, and Kadali Basma is used, and Shanka Churna the yoga, where in the 2:1:1 ratio, Shanka Churna, Haratala, and Shukti are used, and Bhallataka the yoga, where Bhallataka Taila and Snuhik Shira are applied in the form of lepa. And Agara Godika Yoga, where Agara Godika, Haratala, and Kadali Dandarasa are used. And according to Chakradatta, Lepa Yogas are Shanka Basma and Kadali Basma, Haratala. And second one is Raktanjana Churna and Sarshapa Taila. And Taila Yogas are Kusumba Taila, Aragwadadi Taila, Karpuradya Taila, and Kshara Taila. And according to Vaishajya Ratnavali, Lepa Yogas are Sudha and Haratala, and Palasha and Kadali Kandakshara, Haratala, and Kadali Kandajala. And next is Shankabhasma and Kadali Kanda Swarasa and Haratala. Taila Yogas are Kusumba Taila, Aragwadadi Taila, Karpuradya Taila, and Kshara Taila. According to Raja Martanda, it is Halahala Pucha Sadhita Sarshapa Taila is used for Yoni Lomaharana. And according to Haramekhala, Pipali is soaked and triturated with the latex of the snuhi and it is powdered. This powdered mixture is mixed with a equal quantity of Datri Phala and it is applied as lepa. And according to Nibaddha Sangraha, in Yoni Nirlomikarana Adhyaya, Halahala Pucha Sadhita Sarshapa Taila is used and Koshamra Taila is used. Coming to the probable mode of action, in all the above said kalpanas, the majority of ingredients they have haratala, manashila, shankabhasma, kadalikshara, and palashakshara. It can be understood that the hair keratin, it is usually having the sulfur bonds, and haratala and manashila, it helps in breaking these sulfur bonds, which will eventually decrease the cellular energy level, and which will lead to the decreased mitotic activity, and will cause for the cessation of the hair follicle formation. And the other drugs which are mentioned like palasha, kadali, shanka, they contain calcium, potassium, and phosphorus, which will help in promoting the action of the above mentioned haratala and manashila. And coming to the research articles, an experimental study of Karaviradya Taila for Lomashatana action was being conducted, where a comparative study was done between commercially prepared hair removal cream like wheat and classical Karaviradya Taila. It was concluded that in standard group, reddish discoloration, abrasion were noted, and hair regrowth was seen on the 7th day itself. Whereas in the test group, that is the Karaviradya Taila, no irritation, no redness or side effects were seen. And initial days, there were no changes in decrease in hair, but later on the 8th day, there was decrease in the density of the hair follicle was seen eventually. And next, efficacy of the Lomashatana Yoga and hypertrichosis was seen, a conceptual study, and the case study of facial hirsutism was also conducted. Coming to the results, it is observed that the arsenic compounds they inhibit the PDH complex, that is pyruvate dehydrogenase complex, which will prevent the regeneration of the lipomate, which will eventually reduce the citric acid cycle, and which will result in the decreased ATP. So because of these decreased ATP, which will lead to the lack of glucose, so because of which the nutrients supplied to the hair follicle will also reduce, which will hinder the hair growth. And the other drugs
Yes,
like
ma'am, your time is up.
Okay, other drugs will promote for the action of the haratala. Coming to the discussion, there are many other procedures like shaving, waxing, threading, and laser also. But among these, they have many side effects. But the drugs which are used in the Ayurveda formulation, they will not cause any side effects, and even it will cause eventually for the density of the hair to reduce gradually, and it will cause for the cessation of the hair growth. I acknowledge my guide, all the members of my department, and my institution for giving me this opportunity. Don't let the insecurity ruin the beauty you were born with. Thank you.
Now I request judges to ask questions.
Dr. Vasundhara, you were in the last part of your presentation, you were telling that
Yes, sir.
there is no side effect of any of the formulations.
Yes,
Are
sir.
you sure?
Uh,
Are you sure?
yes, sir.
Because most of the formulations which are used in Loma Shatana contain either Haratara or Manashila, or they contain some Kshara like Kadali Kshara. Are you sure that there is no side effect? Please
Uh,
do not make any claims unless you have data.
okay,
Now
sir.
the world is looking for research data. We cannot just make claims saying that it is safe, it is herbal, and it is Ayurveda. No. Okay. You have to have proof to say that it is safe. And most of the formulations which are presented in your content, they contain Haratala.
Yes, sir.
You agree with me?
Yes, sir.
And at the end, you are claiming that they are safe. The last part of your presentation was the same. They are safe. Please do not make such claims. Okay?
Okay, sir.
Unless
Okay,
you
sir.
have data. Unless you have data. I have a very
Yes.
specific question about a book called as Raja Martanda. What is that book? You are telling some formulation from Raja Martanda. What is that book?
Yes. So the last few three formulations of Raja Martanda Haramekala, I have not referred it in personally. Those were the references which I have taken from an article. The previous one were which I referred from the book directly, but these three I didn't refer it from book. I have selected it from an article.
Then please acknowledge. Okay?
Yes, sir, sure. Okay,
When you
sir.
have taken it from something, you please do acknowledge it.
Yes, sir, sure.
Okay. And how many, what you call, you told that you have followed IMRAD format for collection of this data.
Yes, sir.
And what was the methodology adopted?
Methodology.
Whether you had included some books, you have excluded some books, whether you have personally referred it or you have used internet to collect the data, or you
No,
have
sir.
personally referred these books and collected the data.
I have
What was the
personally
methodology?
referred the books for the
Yeah, you
formulations.
referred Garuda Purana then? In
Yes,
the
sir.
beginning, somewhere you were telling us something about Garuda Purana.
Yes, sir. Garuda Purana, Rajamartanda, Haramekala, and the last one I have selected it from the article.
Okay. You use both. You have used book and print media and electronic media to collect
Yes,
the
sir.
data, right?
Yes, sir.
Then you should specify it in the methodology.
Okay, sir.
And in the results, how many what you call different formulations did you get? How many lepas did you get? How many grita? How many churna? How many kshara formulations you got? That you can make a table and present.
Okay, okay, sir.
Okay. Okay. Over to you, sir. Madhukeshwar, sir.
Sir, I don't have any questions, sir. Whatever everything sir is asked, I don't have any question. Next presentation we can move.
Thank you. Now we'll move on to next presentation. Dr. Yangala Sujana Kumari from Bierkar Government Ayurvedic Medical College, Hyderabad. The title of the presentation is Critical Review of Chandana with respect to Varnya Dashemani. I repeat, Dr. Yangala Sudhana Kumari, are you available? We'll move on to next presenter, Dr. S. Rachana. Rachana, are you there?
Yes, ma'am.
Okay, Dr. Bierga Government Ayurvedic Medical College, Hyderabad. Title of the presenter is Yoga Sadhana Ayurveda Foundation Research Journal, a review.
Ma'am, shall I start, ma'am?
Yes, you can start.
Okay,
Share
ma'am.
your screen and you can start.
Is it visible, ma'am?
Yes, yes.
Good evening, everyone. Myself, Dr. S. Rachana, third year PG scholar, Department of Dravya Guna, Dr. B.R.K.R. Government Ayurveda College, Hyderabad, guided by Dr. A. Vijay Lakshmi Madam, Professor and HOD, Department of Dravya Guna. My topic is Twak Prasadana and Varnya properties of Haridra Churna, a review. Introduction. Twak is the largest organ of the body. It has gained lot of importance cosmetologically nowadays. According to the global burden of diseases, skin diseases are the fourth leading cause of non-fatal morbidity worldwide. Bhav Prakasha Nigantu has mentioned Haridra Churna as Varnya and Doshahara. The synonyms Varna Vilasini and Yoshita Priya uh, explains its importance in cosmetology. Tvak Prasadana Dravyas are skin promoting, cleansing, and clearing the impurities of skin. Varnya Dravyas enhance the skin complexion, restores the normal color of skin. Tvak and Varna Vikaras, Rasa Dushti, stress and Dosha Dushti will lead to Tvak and Varna Vikaras. Haridra being Kushtagna, Kledahara, Rakta Prasadana, Medohara, Tvachya will help in Tvak Prasadana and mainly due to Agni Mahabhuta Pradana, Ushnavirya, Kapha Pitta Shamaka, Pitta Rechaka, it acts as Varnya. In Kushtarogas, Haridra Churna can be given with Gomutra and Haridra Churna Lepa acts as Varnya. Coming to Haridra, botanical name Curcuma longa, family Zingiberaceae. Synonyms like Nishakya, Krimigna, Varavarnini. Charakacharya explained under Kushtagna, Vishagna, Lekaniya Vargas. Sushruta is mentioned in Haridradi Gana, Mustadi Gana. Haritakyadi Varga by Bhavaprakasha Nigantu, Pipalyadi by Raja Nigantu, Guduchyadi Varga by Dhanvantari Nigantu. These are the properties of Haridra which are explained in the further slides. Rasa Panchaka, Tikta and Katurasa both are having Kushtagna, Kandugna and Lekana properties. Tikta Rasa has Kledahara, Vranagna, Rakta Prasadana properties. Katurasa is having Vishagna and Kandugna properties. Rukshaguna depletes the Snigdhata, Kafahara and Amahara. Laguguna, Lekana, Ropana and Shigrapaki. Ushnavirya does Kledahara, Agni Mahabhuta Pradana. Katu Vipaka does Kafashamaka properties. These will help in Tvaprasadana and Varnya. Coming to Panchamahabhuta, based on the Rasapanchaka of Haridra, Akash, Vayu and Agni Mahabhuta are predominant. All the Mahabhutas have Sukshma, Lagu and Vishada gunas. Agni Mahabhuta mainly it is having Paka, Prakasha, Prabha, Varna, which help as Varnya. Coming to phytochemical constituents, all the phytochemical constituents are having anti-inflammatory, antioxidant and antimicrobial activities. Curcumin, it increases the hyaluronin production in keratinocytes, acting as moisturizing, and it increases the collagen synthesis. Flavonoids are photoprotective. AR thermarones are main bioactive ingredient which will alleviate skin inflammation and psoriasis. Alpha pinins purify the skin. Beta pinene reduces the irritation and calms the skin. Sesquiterpenes enhance the skin penetration, suppresses the skin cancer. Alpha philandrin, it will reduce the pain sensitivity and increases the energy levels. Camphene is antifungal and aids in against dermatitis and other skin disorders. Mode of action: internal administration, it will act on Rakta Dhatvagni and Ranjaka Pitta, which in turn acts on Rasadhatu and Rakta Dhatu. Through Vyanavayu, it circulates throughout the body and increases the ojas, which reflects on the tvacha and thereby acting as Tattvak Prasadana and Varnya. External application, it acts on tvacha by stimulating Brajaka Pitta, which metabolizes by Ushna Guna and provides impact on the skin by acting as Tvak Prasadana and Varnya. Coming to research activities, there are several research activities done. Curcumin, it topical application will reduce the inflammation and irritation. Volatile oils and curcumin oral administration are reduces acute and chronic inflammation. Curcumin also protects the skin by increasing collagen deposition and angiogenesis. It also suppresses the melanogenesis in melanoma cells through downregulation of tyrosinase and tyrosinase related proteins. Recent studies on turmeric rhizome, it has proven maximum efficacy of 88.56% inhibition of tyrosinase activity, hence supporting its skin whitening property. Curcuma longa extract is found to bring potential changes in skin thickness, increase elasticity, decrease the pigmentation and wrinkling, which is caused due to UVB radiations. Many preclinical studies have been done on curcuminoids, biological activity such as antioxidant, anti-inflammatory, anti-tumor, radioprotective. An in vitro study was done on bovine endothelial cells. The curcumin effect enhanced the cellular resistance to oxidative damage, hence showing its antioxidant activity. Coming to conclusion, Haridra is used both as a household spice and as a medicine. I would like to conclude by saying Tvaprasadana and Varna properties of Haridra Churna clearly are explained by Rasapanchaka, phytochemical constituents and research activities. It is very much important in cosmetology. Uh, Along with this, lifestyle changes in diet management is helpful. In the world of spices, turmeric stands out as a healer, a protector, and a symbol of vitality. These are the references. Thank you.
Thank you. Now I request judges to ask questions.
Dr. Rachana, like your work was exclusively on Haridra.
Yes, sir.
So I have a very specific question. Which type of Haridra? Like there are so many varieties of Haridra. You are a Draviguna student, right?
Yes, sir.
There are different types of Haridra. I have heard of a Haridra called as Amragandhi Haridra.
Yes, sir.
And there are other varieties of Haridra, right? What are
Yes,
they?
sir. Amra Gandhi Haridra, Daru Haridra.
Uh, which Haridra you were speaking about in your
I
presentation?
am mainly speaking about the normal Haridra, Curcuma longa, sir.
Curcuma longa. Okay. There were two contents in a presentation. One is Tvakprasadanam and the other was Varnyam. Okay.
Yes, sir.
And among the Nigantus, there are so many Nigantus. How
Yes, sir.
many Nigantus have considered Haridra as Tvakprasadana and how many have considered it as what do you call
Varnya.
Varnya? Yeah.
Like they have not mentioned specifically as Twak Prasadana, sir. They have mentioned as Twachya or Twakdoshahara.
Okay.
Like almost all the Nigantus mentioned except like Shodala Nigantu.
Except Sodal Nigantu, all Nigantus have mentioned it as?
Almost, so like whatever I have referred.
Okay. Okay. Among the contents, different contents, chemical constituents of Haridra,
Yes,
according
sir.
to which is the most suitable to achieve Varnya property?
Curcumin, sir.
Curcumin. Okay. Yes, sir. Over to you, sir.
Yes, sir. I have one specific question. Is there any side effect of Haridra is there on Tvak Prasadana, Varna Prasadana? It's a practical question.
No, sir.
So Haridra Lepa is advised as a Varna Prasadana, Tvak Prasadana days. So can we ask the patient to go on applying the Haridra Lepa?
No, sir.
And what is the remedy for that? Or what is the solution for that?
Like if excess application of Haridra Churna may lead to rashes, sir. So we can apply like aloe vera gel or anything which is Shita Virya.
So instead of rashes, so Haridra is a coloring agent. It is used as a coloring agent. Curcumin is a strong coloring agent. So go on applying the Haridra lepa, it stains over the skin. So kind of a yellow skin like apparel pump. It will not easily, it will not go easily by washing also, by different face wash also. And one more is Haridra, whenever comes in contact with the any alkaline media, it will turn into red. So go on applying the Haridra lepa over the face and washing with the soap or any face wash creams and all, it will form as a more strains over the skin. So instead of that, a solution is, so whatever the cosmetic companies, so Himalaya and many Dabur and Imami and all, instead of using the Haridra or curcumin, they use the tetrahydrocurcumin. Tetrahydrocurcumin is also a form of curcumin without the yellow color.
Okay,
it is white. It is called as white curcumin. So that will
Okay.
be used to solution for this. So if you prepare the cream out of the Haridra, it is very difficult to apply over the face or any skin also, not only face, own body also, because it stains over the body. So to avoid that, so they remove the coloring agent and they use the tetrahydrocurcumin. That is one of the major side effect. So for the solution itself, tetrahydrocurcumin is invented. It is. Thank you, sir. Thank you.
Thank you, sir.
Now we will move on to next presentation. Dr. Amrita K. from Government Ayurveda Medical College, Bengaluru. Title of the presentation is Exploring the Traditional Ayurvedic Formulations, Malatyadi Taila and Arjuna Takwadi Lepa.
Hello, am I audible?
Yes, ma'am, you're audible.
Is my slide is changing?
Yes.
Okay. Good evening, respected judges. My topic is exploring the traditional Ayurvedic formulations, Malatyadi Taila and Arjuna Twakhadi Leba. Ayurveda addresses both systemic illness and localized ailments. Cosmetic diseases affects the emotional, psychological, and social well-being of affected person. Increased pollution, unhealthy diets, and improper hair and skincare practices, including chemical treatments, have led to a surge in various disorders. Dandruff and facial melasma are two common yet distressing conditions affecting millions worldwide. Dandruff is one of the commonest scalp disorders of high cosmetic value. It is an irritated disease of the scalp in which shedding of dead tissue from the scalp with itching sensation and a common cause for the hair loss. And in Ayurveda, it is mentioned as Dharnaka under Kshudraroga Nidana. And then we'll move on to the another most common pigmentary disorder in the society. It is nothing but facial melasma, and 90% of the patients are women. And it is an acquired pigmentary disorder which is characterized by symmetrical hyperpigmented patches on the face. And Vyanka is one of the Shudra Roga, which is characterized by Niruja and Shavavarna mandalas on the face. And based on these clinical features, we can compare it with the facial melasma. And the prevalence of these conditions highlights the need for the effective and sustainable treatments. And the Ayurvedic medicines provide potential remedies with the Malatyadi Taila as well as Arjuna Tokadi Lepa. And the purpose of the study is to address the practical application in the beauty care and to make people aware of it and to understand its relevance in present era. In Malatyadi Taila, Malati, Karavira, Kapikachi, Chitraka are the ingredients, and these are the drugs which are mentioned in the Malatyadi Taila. And the probable mode of action is Malatyadi Taila ingredients are predominantly of Kashaya and Tiktarasa, Ushnavirya, Kaduvipaka, and Lagu Tikshna Gunas, which are beneficial in lowering the Vata and Kapha imbalance. They also have qualities like Kandukna, Twachya, Kushtakna, which are very effective in alleviating the symptoms of Dharnaga. A soft and gentle massage will improve the blood circulation in the scalp region, which will boost the hair growth and helps to prevent the hair damage. Snigdhada, which is found in the thyla, releases the dryness and reduces shedding. Arjuna, Vaja, Lodra, Manjishta, Sarshaba, along with Saindava and Makshiva, are used in Arjuna Tokadileba. These are the drugs and the respective part which are used in the Arjuna Tokadilepa. More to the more probable mode of action, the Kashaya Rasa of Arjuna Tokadileva removes the Tok Vaivarnadya and helps to attain the normal skin color. Shidavira helps to encounter the Pitta dosha, and the Prasadhana property also helps to purify the accumulated doshas in the Vyanka. Rekta and Twak Prasadhana helps to pacify the Sanchita doshas locally. Thus, it acts as Pitta Shamaka and Rekta Prasadaka. And the conclusion, the Pajana of the localized dosha will be done by the Ushna Guna of Malatyadi Taila as well as the Shodhana of the accumulated dosha by the Tikshna Guna. Thus, it minimizes the Shodharodha of Kapha dosha at the Romakopa. And the Snehamsha of the Guna, Snehamsha Guna, which will helps in alleviating the Vada. And in Arjuna Tokati Lepa, the Kashaya Rasa as well as the Shita Virya helps to reduces the Pitta, and the Rekta Prasadaka and Tok Prasadaka helps in the Rekta Shodhana. And it is also simple, cost effective and OPD based treatment. And natural cosmetics are more beneficial to our health and more effective than the synthetic alternatives. And people today are beginning to demand a total natural body care. So I can conclude my presentation. Thank you, one and all.
Thank you. Now I request judges to ask questions.
Okay, Dr. Amrita, again, I have same comments about your presentation. Please put your title slide.
Okay, sir.
Yeah, looking into the title, I felt that it is a clinical research which you have done by using Malatyadi Taila and Arjuna Klepa, and you have not made an attempt to prepare it. You have not made an attempt to use this on the patients, right? You just compared the properties of Malatyadi Taila and Arjuna Klepa, right?
Yes, sir. Yeah.
Okay. And you have evaluated two formulations. Okay. One is a
Yes,
Taila base, which may be a Snigdha in nature. Other one is a powder, which may be Ruksha in nature.
Sir.
Yeah. Will you use these together, these two formulations together on a patients, or you will use according to the disease condition, you will select either any one of
Sir,
them?
based on the disease condition, Malatyadi Taila in Dharunaka and Arjuna Tokadilepa in Vyanka condition, sir. Both on different diseases.
Okay. Yes, sir. Madhukeshwar.
Thank you, sir.
What are the ingredients? Please show the ingredients of Malatyadi Taila. Ingredient slide.
Sir. Malati, Karavira, Kapikachu, Chitraka, and Kerathaila.
Kerathaila. So all these are Ushna Guna Yukta Dravya, and they are Pitta Vardhaka also. Pitta Vardhaka also. So all these Kalitya, Palitya are mainly related to Pitta condition. So how it will helpful for the pitta to reduce the pitta and improve to the kalitya?
Sir, Malatyadi Taila, I have mentioned it as in Darunaga, which is predominant of Vata and Kapha doshas.
Okay. Is there any market available? Is there Malatyadi Taila?
Yes, sir, it is available.
Which
Cortical
company
and
is
all
that?
it is available. Cortical and all it is available, sir.
Okay. Thank you.
Thank you, sir.
Thank you. Now we'll move on to next presentation. Dr. V. Archana from Government Ayurveda Medical College, Bangalore. Title of the presentation is A Critical Review of Bringamalakati Taila in the Management of Palitya.
Are my slides visible, ma'am?
Yes, it's visible.
Hello. Okay. Namaste, everybody. The presentation of mine today is on a critical review of Bringa Amalakadi Taila in the management of Palitya. My presentation, I'll be mainly concentrating on the critical analysis of the ingredients of Bringa Amalakadi Taila. Introduction. Palitya or premature graying of hair is currently a rising hair related problem. So, in the contemporary medicine, various factors have been attributed to cause premature graying, which may be in the form of food habits like micronutrient deficiency or lifestyle changes, environmental changes, stress, and other conditions. Their way of approach, though it is based on either vitamin supplements or addressing the underlying pathology, as in case of hypothyroidism, etc. The major prevalent one is hair coloring. So, in this condition, Ayurveda has a good scope. And in Ayurveda, it is considered as the Ushna Guna of Pitta, which does the Pachana of Kesha and hence results in Palitya. Though it is not a major disease because it is explained by Acharya Sushruta under Kshudra Roga, but still it affects one's social confidence. And so we need to address it very promptly. So, various Ayurvedic approaches have been explained, and one simple and effective formulation is the topic of discussion in today's presentation, that is Bringamalakadi Taila. So, the ingredients are Yashtimadu Kalka, Tila Taila, and Dravadravya are Bringaraja Swarasa, Kshira, and Amalaki Swarasa. Moving on to Bringaraja Swarasa, the very synonyms of Bringaraja like Markava and Kesha Ranjana symbolize its karma. So Markava is Marayati Kesha Shaukalyam. So it is very much evident that it is effective in Palitya, and Kesha Ranjana is it does the Ranjana of Kesha. And studies have shown that the methanol extract and ethanol and petroleum ether extract of Bringaraja aids in hair growth also. Next is Amalaki Swarasam. As we all know, Amalaki is an Agriya in Rasayana, Amalaki Vayasthapanana, and also it is rich in antioxidants and prevents free radical formation. And since the pathogenesis, the widely accepted pathogenesis even in contemporary medicine is that oxidative stress leads to premature graying. So Amalaki Swarasa has an efficient role in that aspect. And both Amalaki Swarasa and Ringaraja Swarasa have been used even in modern natural hair colorants. Next is Kshira. Kshira is Pittahara, Shitala, and Rasayana in nature and helps to counteract the basic dosha, that is Ushma of Pitta, which is the basic cause for Pachana of Kesha. And also, Kshira contains calcium and various proteins which aids in hair growth. Next is Tila Taila. Taila itself is actually Samskarat Sarva Rogajit, so it enhances the quality of the dravyas with which it is processed with. And also, it has been proved in studies that the liposomes have a major action in delivering of the melanin into the hair follicles. So Tila is beneficial in that way, and also Tila Taila, because Tila is cassia, and also it has been proved that UV rays induced damage can be prevented by the usage of Tila Taila. The Kalka was Eshti Madhu, it is Shita Virya, and it is Pittahara in nature, also Rasayana, and studies have shown that it also has hair growth promoting activity. So, in nutshell, most of the dravyas used in Bringamalakadi Taila are Pittahara in nature, Shitala, Rasayana, and Kesha. And adding on, it is Kesha Ranjana. Bringaraja Swarasa used in it is Kesha Ranjana, and Tilataila has a unique property of Samskarat Sarvarogajit. Hence, it can be a useful, simple, and much effective formulation in the management of Palitya. These were the references used in my presentation. Thank you.
Thank you. Now I request judges to ask questions.
Dr. Archana, do you have any clinical data to prove efficacy of Bringamulaka Thailam on Palitya?
No, sir. We have actually prescribed in our hospitals, but could not do much follow up. So I don't have about its efficacy, sir.
Okay. As per my understanding, there are two words. One is Akala Vali Palitam, which is usually used in Ayurveda for premature graying of hair, and Palityam, which comes because of the age. Okay. And what we have found is in Palityam, most of our Ayurvedic remedies do not work. We have worked out for more than 5 years on some hair dyes, natural hair dyes, and we could not give results like the hair dyes which are available in the market.
Okay.
And maybe the premature graying of hairs, probably our what you call medicines work better. That is what I feel. But again,
Yes,
I
sir.
don't have
Actually,
exact
I
data
meant that
to.
only.
Yeah,
Heading was supposed to be Akalaja Palita.
yeah.
Yes.
Okay, Sir Madhukeshwar, sir.
As sir said, most of the our formulation will not work in the palitya because graying of hair it is very difficult to convert it into black color one. I have only one question: whether Bringaraja, internally it works or externally application it works? Not Bringamalakara Taila, Bringaraja,
Bringaraja.
internally it works or externally it works?
Sir,
Only Bringaraja.
sir, actually, when I had searched for articles in an review study, it was mentioned that even Bringaraja has been used widely in hair colorants also. So I feel external application will have an impact.
Impact, yes, because I ask this question is Bringaraja contains two alkalides. One is viridianolactone. Second one is iron complex. Iron complex, both are there. Viridianolactone and this iron complex, along with the internal administration, it is effective. Internal administration is somewhat effective in the Kesha action one. External application is also it is there because of the iron. It will give a coloring one, but not for longer period. It is very difficult to achieve. Okay.
Okay, sir.
Thank you. Thank you.
Sir. Thank you, sir.
Next presenter is Dr. Yangara Sajana Kumari from BRK Government Ayurveda Medical College, Hyderabad. Title of the presentation is Critical Review of Chandana with respect to Varne Dashemani. We will move on to next
Please move to
presenter.
the next one. Yeah, please move to next presentation.
Dr. Abbavaram Sirichandanam from Dr. Bierkar Ayurvedic Medical College. Title of the presentation is A Critical Review on Malatyadi Taila in Indralupta.
Yeah. Good evening, everyone. Is it visible, ma'am?
No, it's not visible.
Okay. Is it visible, ma'am, now?
Yes, it's visible, ma'am.
Hello?
Yes, it's visible.
Yeah. Okay, ma'am. Good evening, one and all. I am Dr. Sirichandana, PG scholar from the Department of Ayurveda Samhita Siddhanta. My topic is a critical review on Malatyadi Taila in Indralupta. Coming to the introduction part. Hello?
Yes, ma'am. Please continue.
Hello?
Yes, doctor, you are audible. Please continue. Dr. Sirichandana, you are audible. Please continue.
Okay, sir. Coming to the introduction part, hair loss is the most common problem faced by people in all age groups. In fact, one person in every four suffers from hair loss due to pollution stress.
Please move
Hair
your
loss as
slides.
patches on particular area called intrasta, told in Ayurveda.
Excuse me, ma'am. Please move your slide.
It's not moving, ma'am. Where I it's not moving, ma'am.
PDF ಅಲ್ಲಿ ಇದು ಮೂವ್ ಮಾಡಬೇಕು ಅಷ್ಟೇ ಅವರು. Is that PPT or PDF? Hello.
This is a PDF, sir.
Please move the cursor so that we can see the changes in the slides.
Yeah, sir, I'm doing it, but it is not moving.
You please log out once and join again. Meanwhile, Dr. Ananya, we can go to the next presentation.
Okay, sir. The next presenter is Dr. Namrata M. from JSS Ayurveda Medical College. Title of the presentation is Effect of Kramata Panchakarma in Management of Eka Kushta, With respect to plaque psoriasis, a case study. We'll move on to next presentation. Dr. Shweta Prakash Shamarao from Taranath Government Medical College. Title of the presentation is Unlocking the Secrets of Pushpa Dravya as Cosmetic, an Insight into Bhavaprakasha Nigantu.
1 second, ma'am.
Okay.
First, Punarvasu page. Is this so? Screen is visible?
No, ma'am, not seen.
Cancel ಮಾಡಿ. Permission ಕೊಡು. Use camera. On. On.
Hello?
Yes, ma'am.
Okay, ma'am. Good evening, judges. Myself, Dr. Shweta, final year PG student, Dravyaguna Department, TGMCA Ballari. My topic of presentation is Unlocking the Secrets of Pushpa Dravya as Cosmetic and Insight into Bhavaprakasha Niganto. Here I am focusing on the Pushpa Varga Dravyas mentioned as a Varnya. Contents of my presentation are Ashoka and Kamalapatra discussion and research updates. Introduction. Varnya indicates the health status and strength of an individual. And beauty is mentioned as a Rupam Gunam Vayasyagya iti Shubhangam. Rupa is nothing but it is an external beauty, and Gunam is nothing but it is an internal beauty, and Vayasyag is nothing but like long lasting beauty. It causes the Shubhanga. The Varna, as we know, Varna is nothing but it's a complexion. In the process of Varnotpatti, there are many factors which are responsible for the Varna Utpatti, that is Panchamahabhutas, Agni, Shukra, Shonita, and Ahara, Vihara, and Vicharas of the Mata and Pitas. So, in the fifth month of Garbhotpatti, there will be Garbha, Mamsa, Shonita, Upachaya will be there, and Garbhini, Kashata will be there. In succeedingly, in the sixth month, Garbha, Varnotpat will be there, and Garbhini, Kashata will be seen. And
Other than this, the Sara, Sammanana, Sattva, Satmya, Prakriti, and Pramana, Harashakti, these are also responsible for the Varna. And common cosmetics problems and its prevalence rates. Acne, which it is found that it is the eighth most common skin disease, and melasma, its prevalence rate is 1.5% to 33.3%. And oval is like wrinkles, it will be seen in the after 40 years of age. And stretch marks, that is most commonly found in pregnancy period, it is about 50 to 90%. And Tvak Vaivarnata by sunlight or sun exposure, no? It is mainly more than 3 lakhs, that is non-melasmic skin carcinoma conditions. And acute and chronic urticarias, like acute urticaria is about 20% and chronic urticaria is about 1.8%. Now we'll see regarding the references regarding the Varna in our classics. Like the Jataragni is the main factor which is responsible for the Ayu, Varna, Bala, which is mentioned in Grahani Adhyaya. Then Desha, Kala, and Jati of an individual also responsible for the Varna. And in Sushruta Sharidasthana, it is mentioned that 7 layers of skin, and in Charaka, it is mentioned that 6 layers of skin. The first layer of skin is the Avabhasini, that mentions that Sarva Varnam Avabhasayanti. In the same way, in contemporary science, 6 skin complexion types are mentioned. It is fair, whitish, medium brown, brown, dark, and intense dark. Varna Beda is one of the Lakshanas seen in the Oja Vapat, where there will be a Dhatu depletion. In the same way, there are different Varna Vaishamata seen in the diseases, like in Jwara Pururupa, we can see the Varna Hani, and in Kushta Vaivarnata, Raja Yakshma also Vaivarnata we can see, and in Shatakshena also Varna Hani will be there. Now we'll see regarding the Ashoka and Kamala description. अशोकः शीतलस्तिक्तोः ग्राह्य वर्ण्य कषायकः रसपञ्चकः रसर कषायतिक्त लघुरूक्षगुण शीत and कटुविपाक. Part used is stem bark and flower. Doshagnata is kapha Then kamalam shitalam varnyam madhuram kapha pitta chitta. Rasapanchakasar kashaya madhura tikta lagusnigda pichila. And shita virya vipaka is madhura. Doshagnata is kapha it is, and whole plant is used. Then here are the phytochemicals of Ashoka and Kamala Pushpa. It is taken from the International Nomenclature of Cosmetic Ingredients. Ashoka ingredients like apigenin, gallic acid, linolenic acid, linoic acid, oilic acid, palmitic acid, and cetosterol. These all acts as an antioxidant and anti-inflammatory. But these contents are mostly used in cosmetic products like skincare products, toiletry products, or hair and skin products. And Kamala ingredients like chemical compositions like luteol, quercetin, camphorol, all these also acts as antioxidant and anti-aging. And these also used in skincare and sun care products. And now we'll see regarding how we can use this Kamala and Ashoka Pushpa. As a Panchavida Kashaya Kalpana, we can use Swarasa, Kalka, Kwata, and Zimafanta. How we can modify the things. Like nowadays, it is a trend like drinking a herbal tea. So, in the same way, by using the petals of this Ashoka Pushpa or Lotus Pushpa, we can prepare herbal tea or preparing a face packs from these petals, face pack or mask out of it, or how we prepare a rose gulkand. In the same way, petals of lotus and Ashoka, we can use it, and we can prepare a gulkand out of it or jam out of it. And Arka preparations in our classic they told no, by extracting the bioactive components from the Ashoka and Pushpa, we can prepare Arka out of it. And here are some research updates from the Ashoka and Kamala, that flavonoids which are present in the Saraka Ashoka in second stage of skin cancer, it prevented like flavonoids of the Saraka Ashoka. And Nilumbo newspaper extracts acts as a whitening and anti-wrinkle cosmetic agent. Discussion and conclusion. In these both drugs, Madhura Tikta and Kashaya Rasa predominant is there, and they helps in the prashaman of Pitta dosha, that is a type of Pitta, Brajaka Pitta, which is responsible for the Prakruta Avastha of the Vacha. And both the drugs acts as a Vishahara, thereby it helps in detoxification our body. And the ingredients like main chemical constant present in these Kamala and Ashoka, camphor, luteolin, These are mainly antioxidant and anti-inflammatory, anti-aging. And utility of these two drugs in different usage forms by using its bioactive components is needed, and further clinical studies are needed to analyze these two drugs as a varnia. And dermatological conditions are highly contributing to cosmetic concerns nowadays, and it is majorly affect the positive behavior of the an individual socially. So hence an attempt is made to understand the varnia or cosmetic effect of the kamala and ashoka pushpa.
Ma'am, your time is up.
Thank you, ma'am.
Our request.
Okay, these are the references. Thank you.
Dr. Shweta, can you please go to fourth slide of your presentation?
Okay, sir. Yes, sir.
Next one, fourth one.
Okay, sir.
Yeah, please enlarge it.
Hi, sir.
You have cited so many reasons for what you call diseases,
Yes, sir.
skin diseases or diseases related with Varna.
Yes, sir.
Varna Vaishamyata you have referred to, okay?
Hi,
And
yes, sir.
can you please tell in your presentation your focus was on Ashoka and Kamala,
Hi, sir.
and these two drugs act in which level of this content of your presentation?
I mean, which stage you are asking, sir?
Yeah. You have told about what you call Ojo Vyapat, and
Hi, sir.
you have told 6 types of complexion, and you
Yes,
have
sir.
told about reason of Jataragni responsible for what you call Varna. And
Yes, sir.
this Kamala and Ashoka acts at what level? Whether it acts at the level of Oja or whether it acts in different layers of skin. You have probably told about 6 layers of skin also somewhere.
Hi, yes, sir.
Yeah. Which level it acts, Kamala and Ashoka?
Like mainly, Varna, it includes both Agni and Dhatus, everything, no, sir. So mainly that Rasadhatu is the responsible factor. So Brajaka Pitta is situated in Twak, sir. These like Ashoka and Lotus are mainly Pittahara. So thereby it corrects the Brajaka Pitta, sir.
Okay. Sir, over to you, sir. Madhukeshwar.
Yes, sir. I don't have any questions. I don't have any questions, sir. Because next presentation we can.
Thank you, sir. Next presentation is Yangala Sujana Kumari from Dr. Bierkar Government Ayurvedic Medical College, Hyderabad. Title of the presentation is Critical Review of Chandana with respect to Varanya Dashemani.
Yes. Yes, ma'am. Am I audible, ma'am?
Yes, ma'am, you are audible but not visible. Please share your screen.
Okay, ma'am.
This is Lamaya. Starting.
Good evening, organizers. Myself, Dr. Y. Srujana Kumari, final year PG scholar, Dr. BRKR Government Ayurvedic College, Hyderabad. My topic is Review on Charakokta Vanya Mahakashaya, Dashemani. Introduction. The term Ayurveda consists of two words, Ayu and Veda. Ayu means life and Veda means knowledge. Thus, the term Ayurveda means the knowledge of life. Ayurveda is the science that imparts all the knowledge of life. It defines health and factors responsible for its maintenance and promotion. Cosmetology is the study and application of beauty treatments such as skincare and cosmetics. Beauty is an attractive quality that gives pleasure to those who experience it or think about it, or a person who has this attractive quality. Charka explained 10 Vanyamahakashaya Dashemani in Shadvirachana Shatasritiya Ajaya. It includes Svetachandana, Nagakesara, sorry.
The participants number.
Slide. Chandana, Tunga, Padmaka, Ushira, Madhuka, Madhyashti, Sahariva, Payasya, Sita, and Lata. Mode of action according to Ayurveda. Vanyadravyas, when used externally or internally, acts on Rajak Pitta. Rajak Pitta is an important factor related with Varna. Ushnavirya stimulates Rajak Pitta and does Raktavardhana, so helps in improving skin complexion. Madra Rasatmaka Dravyas increases the production of Rasa, Rakta, Majja, Shukra, Oja, which in turn acts on Varna. Madra Rasa and Tikta Rasa Shitavirya has Pittagna action. Madra Rasa Shitavirya acts as Ojavardhaka, thus helps in enhancing skin complexion. Madra Rasa and Madra Vipaka Ushnavirya has Vatagna action. Kashaya and Tikta Rasatmaka Dravyas absorb Kleda and cools down Pitta, so results in purification of blood, Rakta Shodhana. So it relieves fluidity of blood. This leads to Varna Prasadana. So we can say that Dravyas in Vanya Mahakashaya acts as Vanya, Rakta Prasadaka, Raktavardhaka, Rakta Shodhaka, Ojavardhaka, Pittagna and Vatagna. So Yashimadu and Svetachandana Manjishta stabilizes aggravated heat in body and blood. Sariva and Manjishta improves digestive power along with Durva and Kshiravidari works on Shleshmaka Kapha to produce fine quality of Rasadhatu. Mode of action according to modern. According to modern, Vanyadravyas disrupt the melanin formation pathway through tyrosine inhibition, so these are potentially excellent whitening agents that improves skin color. These are the some formulation from Charaka, Eshtiyadi Lepa, Chandanadi Taila, Kaliyadi Lepa, and Sarivadi Lepa. Conclusion, Vanya Mahakashaya stated by Charaka Acharya are really effective for enhancing skin complexion. Majority of dravyas in Vanya Mahakashaya are Madratikta Rasatmaka, Kapha Pitta Shamaka, therefore shows Vanya effect. They can be used externally or internally. So Vanya Mahakashaya described by Charaka are useful in enhancing skin complexion. So we should use these herbs in different combinations and forms to treat patients to obtain glowing skin complexion. Vanyadravyas has high antioxidant and anti-inflammatory potential. These are the references. Thank you.
Thank you. Now I request judges to ask questions.
Doctor, this Varnya Mahakashaya is told in Charaka. Varnya Mahakashaya is told in Charaka.
Sir, I apologize, sir. I will correct it, sir.
Why? It's mentioned in Charaka or not?
Mentioned, sir, but in the slide it was wrong, sir.
Okay. Which sthana it is mentioned? Which chapter it is mentioned?
It is in Shadvirachana Shatasritiya Ajaya, sir. Fourth chapter. Fourth chapter, 8th sloka, sir.
Which sthana?
Sutrasthana, sir.
Sutrasthana. Okay. Doctor, in your slide, 5th slide, you were highlighting Madhura guna of the drugs, and in 6th slide, you were highlighting Kashaya guna of the drugs. Kashaya rasa of the drugs.
Yes, sir.
Which is true? Madhura guna, Madhura rasana or Kashaya rasa?
Sir, Madhura rasa, sir.
Madhura rasa. No, in 6th slide, you were highlighting Kashaya rasa of the drugs, and 5th slide, you were highlighting Madhura rasa of the drugs. That is why I had a doubt.
Sir,
And any research works have been done on these Varna Mahakashaya drugs?
Sir, currently I don't know, sir.
Okay, sir, Madhukeshwar, sir.
How many market available formulations are there based on the Charaka Varnya Kashayagana?
Sir, I apologize, sir. Currently I don't know, sir.
Next year.
Okay. Okay, sir. Thank you.
You do it, Jaja. Thank you, sir. Now we'll move on to next session. So next presentation. Dr. Shweta Prakash Shamarao from Taranath Government Ayurvedic Medical College, Ballari. Title of the presentation is Unlocking the Secrets of Pushpa Dravya as
ಆಯ್ತು
Cosmetics.
ಡಾಕ್ಟರ್ ಆಯ್ತು over. Right, Shweta Shamrao have completed presentation.
Yes, sir, I have completed, sir.
Yeah.
Sir,
Dr. Namrata is left.
sir, I have one question.
Sir, me.
Sir?
Dr. Namrata is left, I believe.
Yes, sir.
Okay, we'll move on to Dr. Namrata M from JSS Ayurveda Medical College. Title of the presentation is Effect of Kramata Panchakarma in Management of Ekakushta with respect to plaque psoriasis, a case study.
Ma'am, is my slide visible?
No.
Ma'am, now?
Yes, it's visible, but open your PPT.
Ma'am, now?
No.
Shall we go to next presentation, Dr. Ananya?
Okay, sir. Okay, we'll move on to next presentation. Dr. Sahana from Government Ayurveda Medical College, Bengaluru. Title of the presentation is Ayurvedic Romashatana Yoga for depilation with respect to hypertrichosis. Dr. Sahana?
No. Next.
Next presenter is Dr. Sanganna Gowda VP from Bierkar Government Ayurvedic College, Hyderabad. Title of the presentation is A Critical Review of Rutu Vishesha Mukalepa.
Excuse me, madam, am I audible?
Yes, you're audible.
Very good evening to everyone. My slide is visible, madam?
Yes, sir, visible. Please continue.
Okay. Very good evening to the distinguished judges. My presentation topic is a critical review of Rutu Vishesha Mukalepa with special reference to cosmetology. Myself, Dr. Sagan Gowda. I am a PG scholar in the Department of Dravaguna in Dr. B.R.K. Government Ayurvedic College. Introduction. It is said that face is the index of mind and it has much cosmetic importance. And in Acharyas in Ayurveda have mentioned Mukalepa for promoting the healthy skin. They have also mentioned Ritu Anusara Mukalepa for addressing the disorders of skin, especially caused due to Sanchaya and Prakopavastha of doshas in respective Ritus. Various synthetic chemical-based cosmetic products are used to look fairer and attractive. It was found that an average adult uses 9 cosmetic products daily. More than 25% of women use 15 or more. These cosmetic products, due to their multiple ingredients, are top causes of toxicity exposure. Cosmetics, toiletries, and skincare products, including sunscreens, quite frequently cause adverse reactions and are the commonest single reason for hospital referrals with allergic contact dermatitis. Now we'll see the mode of action of LEPA because Mukha LEPA is also LEPA only. LEPA applied against hair follicle direction, that is Pratiloma Gati. It will facilitate quicker absorption of the drug potency through Roma Kupa, Svedavayini and Siramukha. Application of LEPA when it is done with the help of gravitational pull and Upashoshana property of Vana and Samana Vayu, uh, it, uh, there is penetration and absorption of LEPA over the twak. And after absorption in twak, drug action on skin pertaining to its Virya and Prabhava is seen. And the Brajaka Pitta present in the skin metabolize the LEPA and it imparts color and complexion. According to modern, Varna Dravyas disrupts melanin formation pathway through tyrosinase inhibition. Hence, it is potentially excellent whitening agent that help in improving skin color. I have done the review of literature. I'll just say a few things. Mukha Lepa is the herbal paste which is applied on the face to treat the Yavan Pidika, Mukha Doshika, scars, marks, and pigments. It is called as Mukha Lepa. Types of Mukha Lepa are Doshahara, Vishagna, and Varnakruta. Contraindications of Mukha Lepa. It should not be applied on the person suffering from Pinasa, Ajirna, and after Nasya Karma, Arochaka, Anugraha, and after being awake on the night. That is Jagarana. Benefits of Mukha. If applied properly, it cures premature graying of hair, Venga, and Nilika. That is hyperpigmentation. It detoxifies the skin
and enhance the beauty of the skin, prevents aging of the skin, reduces skin wrinkles and tones the skin, pacifies pigmentation, decreases discoloration of skin. Time for Mukalepa. As stated earlier, Mukalepa should not be applied at the nights, nor it should be allowed to stay on after it dries up. Direction for Mukalepa, as stated earlier, it should be Pratilomagati, against the direction of hair falls. Yat Pinde Tat Brahmande, Nyaya from Ayurveda and Loka Purusha Samya Siddhanta suggests that there is a huge influence over the skin, like body, by the ever-changing environment. Since the skin is the largest sensory organ, it is obviously seen in the skin also. You'll we have seen different lepas mentioned. Ushnakala lepa mentioned Chandana, Karpura, Sugandavala lepa is Shitala. Therefore, it is suitable as anointment in hot summer season. During Vasanta Ritu, kapha diminishes digestive fire and gives rise to many diseases. After mitigation of kapha, one should besmear body with chandana and aguru. In Grishma Kala, the sun rays become more powerful and vata increases gradually. Hence, it is advised that during Grishma night, one should besmear the body with sandal paste. In a hot environment, sweating is the mechanism for increasing heat loss. Thereby, thermoregulation is achieved. Shitakala Lepa, Kunkuma, Chandana and Aguru mixed lepa is hot and mitigates vata and kapha. Therefore, it is suitable in cold season. In Hemanta, digestive power is more powerful. Ashtanga Sangrakara advises external application of Agaru and Kunkuma, while Yoga Ratnakara advises application of Agaru, Kunkuma and Kasturi. Same rituals of Hemanta should be performed in Shitshira also. Continuous contact of cold winds, as mentioned as one of the causative factor for Shita Pitta by Acharya Madhava. In a cold environment, cutaneous vasoconstriction and shivering are protective mechanism for thermoregulation. In Varshakala, digestive capacity of individual is low. Chandana, Keshara, Mruganavi, mixed lepa, which are neither hot nor cool, are advised. Here are Rutu Vishesha Mukalepa explained by.
Excuse me, sir, your time is up. Please conclude.
Here we note that there is a combination of Varna Dravya. There are two aspects into it. There is a combination of Varna Dravya as well as set of drugs which will counter the seasonal imbalance of the doshas. In Shishira Rutu, Simi Muladi Lepa, for example, drugs like Brohati, Krishnatila are they specify the Sanchita Kapha, and drugs like Daru Aridra are Varnya, and they act on the Brajak Pitta and bring Varnya action. The analysis of Ayurvedic classics reveals that seasonal changes in human skin have been well documented. Efficacy of Ritu Anusara Mukalepa has been supported through a detailed analysis of properties of ingredients of these recipes. These above said Mukalepas, which are natural, cheap, and with minimal side effects, are important for preventing skin disease. However, further research, including survey studies, clinical trials, is necessary to validate effectiveness of these formulations in contemporary practice. Thank you, sir.
Thank you. Now I request judges to ask questions.
Doctor, do you have any direct references about Ritu Anusara Mukhalepa that is mentioned anywhere?
Yes, sir. In Ashtanga Hridaya, sir. Gandusha Vidyadhyaya.
You have collected all this information from Ashtanga Hridaya?
No, sir. I have done the various other like Sharangadhara Samhita and Ashtanga Madhava.
Madhava? Which book Madhava?
Madhava Nidana, sir. That is like
Madhava Nidana have mentioned this, sir?
No, sir. Like I have done the review of literature, sir. There that in Shita Pitta Nidana, it is mentioned that cold winds cause Shita Pitta, sir.
Okay. Now, about these formulations, have you got any reference in Madhava Nidana?
No, sir. No, sir.
No. Okay. Whether there is any research work done on any of these formulations mentioned in your Ritu Anusara Mukhalepas?
Sir, no trials, sir, exactly.
No trials have been done.
Yes, sir.
Okay. Have you found any articles related with this when you were searching?
Yes, sir. Yes, sir.
Yeah.
There are 2-3 articles regarding this.
2-3 articles. Sir. Okay. Have you taken any content from those articles?
Sir, no, like I've referred, sir. I didn't.
You have not
read it.
included any of those contents of those articles, sir.
Yes, sir.
You have not included.
No, sir.
Okay. Okay. Yes, sir. Madhukeshwar, sir.
Is there any market availability? Lepa is there based on the Rutu Anusara?
No, sir. No special like that.
Yes, is there. We use it every day. In summer season, we use one of the powder for body as well as the face also. Dermicool powder. It's an Ayurvedic product. Product. So it is based on the Rutu Anusara only. It is ads also will come only in the summer season itself. In the season. Other season it will not use that. So that is a market availability is there. It is a Dermicool is an Ayurvedic product. So based on that, we can say it is a Rutu Anusara Mukalepa.
Okay, thank you, sir. I haven't looked into it, sir.
Okay, okay. Thank you, sir. Thank you.
Thank you.
Thank you. Now we'll move on to next presentation. Dr. B.B. Aisha Farash from Ashwini Ayurvedic Medical College and PG Center, Davangere. Title of the presentation is Various Kalpana in Ayurveda, Trichology and Cosmetology.
Hello, good evening, everyone. Hello, am I audible?
Yes, ma'am, you're audible. Please rotate your screen.
Yeah, okay. Yeah, okay. Hello, everyone. Myself, Dr. Aisha from Ashwini Ayurvedic Medical College and PG Center, Davangere. Actually, my topic while I was submitting abstract was the various kalpana. I have specifically made a presentation on the Manjishta Lepa application in the disease Venga. So I'm presenting on behalf of that. So like Venga is a skin disease affecting face, which is a small circular brown patch on the face, and is one of the most common disease found in 90% of the women. So in modern, it is compared with the melasma because it has similar symptoms that are described by the Bhava Prakasha. That is the cardinal features that is Pratatma Lakshana of the Venga are Niruja, Tanu, Shava, and Mandala. That is painless, brown to blackish discoloration, discolored patches, circular in the nature, mostly found on the face. So Venga, it mostly affects the natural beauty by the hyperpigmentation, and the causes of Venga, according to Ayurveda, include Krodha and Ayasa, whereas according to the modern, the melasma is caused by the exposure to the excess exposure to the UV rays and estrogen hormone and stress related factors. Here, according to Ayurveda, the Krodha and Ayasa leads to the prakopa of the Vata, Pitta, and this Vata and Pitta in turn does the Dushana of the Rakta. So the Dushita Vata, Pitta, and Rakta gets a Sthana Samshraya in the Tvacha. That Dushita doshas are found on the face. That is found in the discoloration, brownish discoloration, brownish to black. So, like Manjishta, here it is actually a case study published in the International Journal of the Biology, Pharmacy, and Allied Sciences. The case study, which has done by the PG scholars of Swastha Ritta and Panchakarma department doctors of the SDM College and Hospital, Hassan. So here, Manjishta is taken according to the reference of Charaka Sutrasthana, fourth chapter, where the Manjishta is one of the Varna Mahakashaya. So Manjishta is having the properties such as it is a Madhura Tikta and Kashaya Rasatmaka, Katuvipaki, Ushnavirya, and it is having Guru and Ruksha Guna, where the Kashaya and Madhura Rasa of Manjishta reduces the Brajaka Pitta, which is causing the skin diseases, and Ruksha Guna of Manjishta elevates the Snigdha Guna, and Pitta Guru Guna of the Guru Guna of the Manjishta reduces the Lagu Guna of Vata. So this both of the guna break the samprapti of the venga, whereby leading to the relevance of the symptoms. Here the Manjishta Churna Lepa prepared by using the fine powder of the Manjishta Churna mixed with the cucumber juice. Cucumber juice here specifically taken as cucumber consists of more than 90% of the water and contain antioxidants and nutrients such as vitamin K, B, C, and beta carotene and flavonoids and phenolic compounds, which is beneficial for the skin. The method of application of the this lepa is the lepa should be applied externally over the affected parts, that is where the melasma is mostly seen, the brown patches are mostly seen on the face, that is on malar region. And in Ayurveda, as the lepa should be applied only during the daytime but not during the night. That is, before application of Manjishta Lepa, one should wash the face with a lukewarm water followed by application of Lepa. Then the Lepa is applied and it should be left to the place for 15 to 20 minutes, and it should be rinsed off. And along with the application of the Lepa, one should also follow the Patta because the most of the skin diseases are caused due to the internal disturbances of the doshas also. And the Pattahara includes such as vegetables and freshly prepared fruits, food, avoiding mainly the excess oily foods and Viruddha Ahara, and also the regular sleep pattern and lowering the stress levels also. Here, whereas the melasma is actually a painless disease, but it affects mainly the psychological as well as a physical condition of a human, because it is caused by both sharirika and manasika doshas. So, with the help of the cost-effective Ayurvedic formulations, which even can be the lepa can be prepared in home and can be applied. Here, the Manjishta Churna Lepa, the case study has shown that one should apply it for at least 1 to 2 months to get a better results. Okay, thank you.
Thank you. Now I request judges to ask questions.
Dr. Aisha, what was the, like, it was a case study?
Case study on the Manjishta Lepa, sir.
Okay.
Manjishta Lepa, that is Manjishta Churna, was mixed with the cucumber juice.
Okay. What was the quality standards of Manjishta that was taken?
Quality standards in the sense, you're asking about.
Yeah, there are some quality standards that are given in API about every drug. Whether the Manjishta that was taken for the study fulfills the requirements of the standards mentioned in API? No idea.
Hello?
Yeah, you didn't hear me?
Yes, sir. So
Yeah.
actually, I have studied only the properties of the Manjishta Lepa. In the article also, there was no standards, like at the end of the article also, there are no standards mentioned as such.
Okay. And you were telling that it's cost effective. What was the cost of this treatment, like the powder that is prepared? What are the cost of raw material? And how do you claim that it is cost effective?
More than the cost effective, sir, I can say it is accessibility, like easily available in the sense maybe the less ingredient in making mistakes.
No, no. At the end conclusion, you were telling that it is a cost effective formulation. That is why I was just asking, what is the cost of Manjishta?
Um, Not exactly knowing, sir, actually.
Okay. Yes, sir. Madhukeshwar, sir.
So it's in a case study whether the melasma is or venga, not melasma, venga is whether it is caused due to sunburn or any other natural discoloration.
Yeah, it is mentioned that it is caused due to the UV exposure plus estrogen and progesterone
In your
hormones.
case study, the patient whether it is diagnosed it as UV because of the
Yeah.
UV radiation,
Yes.
melasma
Yes.
is there.
Yes. In case study, actually, she was a 45 years old female patient, and after attaining the menopause, and due to the sun exposure, she got this venga.
Venga. Okay. So it is completely relieved. Symptoms is completely relieved.
Yes, sir. Not like 100%. After 2 months of application of the labor, like daily, sure, the discoloration was reduced up to 80%, 70 to 80%.
Okay. Okay. Thank you.
Thank you, sir.
Thank you. Now we'll move on to next presentation. Dr. Sushmita H. from Sri Shivayogeshwar Rural Ayurveda Medical College and Hospital, Injal. Title of the presentation is Conceptual Review on Ayurveda Trichology and Cosmetology. Dr. Sushmita H. We'll move on to next presentation. Dr. A. Kavya Rashmika from Biyarkar Government Ayurveda Medical College, Hyderabad. Title of the presentation is A Review on External Application of Malatiri Taila in Darunaka. Dr. Kavya.
Hello, good evening, ma'am.
Yes, ma'am, you're audible.
Is my slide visible, ma'am?
Yes, ma'am, visible. You can start.
The slide is not moving. Just give me a second. Good evening to the respected judges. Myself, Dr. A. Kavya Rashmika. Today I am going to present a review on external application of Malatyadi Taila in Dharunaka. My introduction is hair is a complex and fascinating biomaterial that plays a crucial role in human identity, and it is the second fastest growing tissue in human body. It serves multiple functions including protection And the causative factors of hair fall is due to hormonal, genetic, environmental, and psychological factors. As dandruff is a scalp disorder which sheds the scalp skin cell at a faster rate than usual, along with itching and hair fall. And the prevalence of dandruff is increasing day by day, and it is around 50% of adults worldwide, more commonly seen in men than in women. Today, I have taken the Darunaka, and the causative factors of it is as the pollution is increasing and intake of improper ahara like fast food and improper vihara, not application of proper hair oil, exposure to excessive heat, etc. causes Darunaka with the symptoms of Khandu, Rukshata, Twak, Sputana, Keshachoti, etc. due to the visheshan of Kapha and Vata dosha. I have chosen Malatyadi Taila, which is mentioned in Vrinda Madhava, helps in treating Darunaka. These are the ingredients of Malatyadi Taila. They are Malati Patra is used, Karavira root, Chitraka root, Karanja root, Tilataila seed is used. And the method of preparation of Malatyadi Taila is Tilataila is taken in one part along with Kalka of Chitraka Moola, Shuddha Karavira Moola, Malati Patra, Karanja Bija is taken in 1/4 part and Jala is taken in 4 parts, which is prepared in Taila formation till Karapaka Lakshana is being formed. And the Samprapti of Darunaka is, as per the etiology, mainly Kapha and Vata dosha gets vitiated. According to Ashrayi Bhava of dosha and dusha, the Pitta dosha is related with Dushita Rakta. As the Prajaka Pitta is located in skin, when Pitta is vitiated in Darunaka, Rakta is also get vitiated due to the Ashrayi Bhavas. And the vitiation of doshas circulate through the blood vessels and reach the scalp, leads to the progression of disease through Chaya, Prakopa, and Prasara Shreyas. Later in Sthana Samshraya stage, it interacts with the doshas like Raktha and Twak and leads and enters into the Svetavaha Srotas and Raktavaha Srotas Drushti, which causes Shrota Adarana and Cirrus and leads to Darunaka with the following symptoms like Dharuna, Rukshata, Keshachoti, Twaksputana. As Kapha dosha and Vata dosha are predominant in Darunaka, Kapha dosha which leads to Kandu, and Visheshan of Pitta and Vata which leads to the Keshachoti, and Visheshan of Vata which leads to the Ruksha Guna, and Kapha and Vata Prakopa may also lead to the Twaksputana. And these are the Rajpanchak of Malatyadi Taila. Mostly the rasa which possesses in Malatyadi Taila is Tikta Katu Kashaya rasas along with Lagu Snikda Gunas and Tikshna Guna, and mainly Tila Taila which possesses the Snikda Guru Sukshma and Vyavayi Gunas. And all the ingredients in Malatyadi Taila possess Ushna Virya and Katu Vipaka, except Tila Taila which possesses the Madhura Vipaka. And the karmas are Vata Kapahara, Tridoshagna, Lekana, Shotagna, Pushtagna, Keshya, Twacha properties are present. And the phytoconstituent present in Malatyadi Taila are alkaloids, glycosides, camphorol, mostly flavonoids, and polyphenols. These are only are present in Malatyadi Taila. Probable mode of action of Malatyadi Taila, as it possesses the Katutikta Kashaya Rasa, Lagu Tikshna Ushna Guna, Katu Vipaka helps in alleviating the Kaphavata doshas. And Katu Tikta Rasas helps in alleviating Kandu Swayatu, which also acts as Deepana Pachana properties, along with Ushna Guna. And Lekana of Chitraka and Malati helps in scraping the vitiated doshas, especially Kapha, and helps in removal of obstruction root hair and helps in regeneration of hair follicle by improving the circulation. It also removes the toxins from body and helps in relieving the skin disorders. Madhura Rasa of Tila Taila helps in normalizing the Pitta dosha and alleviates the symptoms like Daha. And it also, Tila Taila also possesses the properties of Kesha and Twacha. It has Nehana Guna, which decreases the dryness and reduces the shedding of the scalp. Abhyanga with Malatyadi Taila helps in improving the blood circulation in cirrus and increases the hair growth. And some of the ingredients in Malatyadi Taila also possess the Kandugna property and also acts as Shrota Shodaka. Especially Malati Chitraka and Karavira possess the Krimigna property, which may be the causative factors of Darunaka, according to modern. Plumbagin present in Chitraka, which mainly acts as antimicrobial, anti-inflammatory, and antioxidant properties. It also contains flavonoids, phenolic compounds which has antioxidant property and helps in clearing the scaling of scalp and helps in regeneration of hair follicle by clearing the obstruction at the hair root. Vitamin C, which is mainly present in Tilathaila, along with zinc and calcium, acts as antioxidant and antimicrobial, helps in regeneration of hair growth. A discussion of Malathia Thaila, as it possesses the following properties, particularly Lepana. This shows the scraping action in scalps, helps in removal of hair root obstruction and helps for the regeneration of hair. Abhyanga with it alleviates Kandu and Rukshanas. Putana by Tikta Kashaya Rasa removes the accumulation of malas, and Thaila penetrates and absorbs into the scalp, increasing the Snigdha guna and nourishes the hair follicle by increasing the circulation in cirrus. It also has anti-inflammatory and antioxidant properties. Conclusion: because of the various phytoconstituents and rasapanchakas mentioned of the ingredients, it can be used in Darunaka. It can as Abhyanga and given along with the internal medications like Arogyavardhini Vati and following. And I have found a research article on comparative clinical study of Malatyadi Thaila Abhyanga and Durdara Patradi Thaila Shirobhyanga, which shows that Malatyadi Thaila is more effective and helps in relieving the symptoms of Darunaka like Kandu, Rukshata, Keshachuti and etc. More than the Durdara Patradi Thaila. These are the references. Thank you, sir.
Thank you. Now I request judges to ask questions.
Dr. Kavya, can you go to your title slide?
Yes, sir. Yes, sir.
Okay. It was a review on Malathya Thailam. You did not prepare it, right?
Yes, sir. No, sir. No.
You know, somewhere you have told method of preparation in 4th or 5th slide.
Yes, sir.
4th slide you were speaking about preparation. So I thought you have prepared Malathya Thailam. Have you prepared Malathya Thailam?
No, sir. No, I have not prepared. I have just mentioned that preparation of Malatyadi Thailam, sir.
Okay. Yes, sir. Madhukesh, yes.
In the study, in the review article or in the study one, whether Darunaka, there are different types of Darunaka is there. One is genetically also is there. There is a scaling of scalp hair or even skin also is there. Or a simple pteriasis. Pteriasis also is there, which is taken.
So simple pteriasis is only taken, sir, here. It's
Simple
not
pteriasis
genetical.
is taken. Not genetically, it is excluded.
Yes, sir.
Okay.
No, sir.
Age group? Age group?
Age group is around 15 to 50 years of age, sir. In that article, it is mentioned.
15 to 50 years. Okay.
Yes,
Thank
sir. Yes, sir. Thank you, sir.
We move on to next presentation. Next presenter, Dr. Gonchigara Pravina Kumara from BVVS Ayurveda Medical College and Hospital, Bagalkot. Title of the presentation is Effect of Shamibijadi Lepa in the Management of Athiloma with respect to hirsutism.
Namaste to all. Is my PPT is visible?
Yes, it's visible.
Actually, my topic was changed, ma'am. The abstract in that it was changed. My abstract was this one only. Hello.
Yes, sir. Continue. You can continue.
Okay. Respected judges, myself, Dr. Praveen Kumar, a second year PG scholar from the Department of Rashashastra and Biology Kalpana, BVS Ayurveda Medical College and Hospital, Bagalkot. Today's my topic for the presentation is management of Yavana Pidaka with special reference to Acne vulgaris through Ayurveda, a single case study. Content of this presentation includes content introduction, case profile, Samprapti of Yavana Pidaka, probable mode of action of the used formulations in the case, and discussion and conclusion. Introduction, the Yavana Pidaka is explained under the Shudra Roga, as it is occurs in the Taruna, that is adolescence. It is also called as Tarunya Pidaka, and it is also called as a Mukhadushika. It's as this in consider with signs and symptoms, it is correlated to the acne vulgaris in modern science, and it is prevalence rate is about 35% to 90% among the adolescent. In equal, it is both equally in men and women. It is acne vulgaris is a follicular disorder affecting the sebaceous glands over the face, neck, upper trunk, characterized by both inflammatory and non-inflammatory lesions. Case profile, a 22-year-old male, not a known case of diabetes mellitus, hypertension, or thyroid dysfunction, presenting with pus-filled lesions and blackheads over the cheeks since 5 to 6 months, associated with the itching, burning sensation, and pus discharge, aggravates on taking the oily, spicy foods, and relieves with medications. No history of fever and chills. Past history is nothing significant, and family history was all are said to be healthy. No similar complaints among the family members. Personal history, diet is mixed, appetite is good, bowel is 1 to 2 times soft in consistency, and micturition is 4 to 5 times per day, and 1 time at night. Sleep it is adequate, and about 6 to 7 hours. uh, Systemic examination, all the systems, that is the GIT, CVS, RS, and CNS, or no abnormality was detected. Local examination was examination of the lesion over the cheeks. The skin of the on the face of the patient was very greasy. The eruptions were located at the cheeks with the multiple reddish inflamed papules and pustules. The eruptions were dense and associated with the mild tenderness. Diagnosis was Yavana Pidaka, and treatment advised is the principle of the treatment is includes Rakashodhana, Rechana, and Rukshana. Here the Rechana is done by as it is Mahamanjishadi Kashaya and Kaishara Gukulu over both contains Rechaka Dravyas, that is Trivrut and Danti, and Mahamanjishadi Kashaya, it was given 15 ml TID with the equal amount of boiled and cooled water after food. Kaishara Guglu 2 BD after food, and Gandhaka Rasayana, it was given 1 TID after food. Estimadu Churna for external application, it is given as a Rukshana therapy. This is a result of the after the medication. After 21 days, the symptoms like burning sensation was reduced. Mild itching was also reduced. This is after 50 days. Samprapti of the Yavana Pidaka, as it is told in as Shushruta Samhita, it is Shalmali Kantaka Avat Pidakas were seen in the Mukhadushika. The due to the Nidana, the vitiation of the Kapha and Vata dosha will take place as it these doshas will vitiate the Rakta Dhatu, which in turn further vitiates the Meda Dhatu. This way, excessive Meda Dhatu will produce the excessive Mala, that is Sweda, and excessive production of the Sweda will stays in the Lomakupa, and it will stays in the Mulasthana of Sweda Vashrotas, and it will leads to the Sangha, and it will leads to the Yavana Pidaka. In modern science also, it is told a similar pathology will be there. Probable mode of action of the dravyas used, formulations used. Mahamanjishadi Kashaya, it is explained in Sharangadhara Samhita, Madhyama Kanda. It is explained indication explained that it is indicated in Ashtadasha Kushta, and Vatarakta, Hardite Tata. Means it is as it is indicated in Vatarakta, we can it will reduces the Vata and Rakta doshas, Visheta Rakta doshas. After mode of action includes as we critically analyze the karma of the each drug, we can say that the majority of the drugs possesses the Rakta Shodaka, Kriminashaka, Dahara, Varnya and Kushtanashaka properties. Hence, it is useful in Rakta Vikaras and drugs like as it contains the Manjista, Chandana, Sariva, etc. pacifies the excessive pitta, and herbs like Sariva, Manjista, Haridra improves the skin tone and texture by promoting the healthy blood flow. And Pipali, Udicha, Pata helps in prevention of ama. That will it will also does the amapachana. And Kaishara Gugulu, it is indicated in Kusta and Vatarakta, and it is a Tridoshagna. And the majority of the dravyas in the Kaishara Gugulu, it will have Tikta Rasa. It specifies the Pitta dosha, and also it is Deepana, and by which it increases the Agni and Pachana karma, helps in Amapachana. Tikta and Kashaya Rasas also helps in decreasing the Kleda guna of Rakta and Kapha. The maximum ingredients are having the Ruksha Guna, Lekana and Shoshana property helps in the clearance of Shrotorodha. And in general, the Kaishora Gugulu is Tridosha Shamaka, Rakta Shodhana, and along with it is having action of Rasayana. Gandhaka Rasayana, it is explained in Yogaratnakara Rasayana Adhikara. It is indicated in Kandu and Kushta. And if a person is having if a person is pitta prakriti, or if it is he is having a pitta ruddhi in the sharira, then it will be lead
Sir, time is up. Please conclude.
okay. It is a pitta shamaka and rakta prasadana. So it will be helps in samprapti vigatana, and it is having krimigna property. The study was conducted. Result was significant in as antibacterial. Discussion is according to Ayurveda, the acne is developed because of a kapha vitiation may resembles with the excessive production of sebum, and vata vitiation resembles the hyperkeratinization, and rakta vitiation resembles the inflammatory mediators in the blood. Drug like Manjishadi Kashaya, Manjishadi Kashaya, Kaishara Gugulu and Gandhaka Rasayana and Estimate Churna are helps in the specifying the Dridoshas and acts as Rakta Shodhana. Conclusion: acne vulgaris is a chronic inflammatory condition of the skin in youth. It is manifested in adolescence, thus it called as Ivanapidica or Tharanapedica. Both modern and Ayurvedic science have considered the use of topical as well as oral medications and their combination for the treatment of acne. Thank you.
Thank you. Now I request judges to ask questions.
Dr. Praveen, when you are doing a case study, it does mean that it is single. When you do it on multiple patients, it is called as case series.
Okay,
and
sir.
when you do it on single patient, it is called as case study. So you need not specify it as a single case study in the title. That is my
Okay, sir.
suggestion for you. And in the fifth slide, can you please go to the fifth slide? You were focusing on the Chikitsa Siddhanta, where you were telling
Yes, sir.
Virechana, Rakta Shodhana, and Rukshana, something of that kind.
Yes, sir.
Yeah.
Yes, sir.
Rechana. And you told that Mahamanjishtadi Kasha and Kaishara Gugulu helps in Rechana because it contains Trivrit and in your,
Yes.
yeah, in your case study, what was your observation? After taking Mahamanjishtadi Kasha and Kaishara Gugulu, how many times patient had purgated?
It is not like a classical rechana, sir, but it is the excessive pitta, that is pitta rechana, it will done, sir.
Okay, it's not Virechana.
Yes, sir. It is not classical rechana, but rechana action is needed, though it will does by Trivritam Danti as it is contains in Mahamajistadi Kasha and Kaishara.
No, do you mean that this Chikitsa Siddhanta that has been told is only for such Rechana, or it is actually a Virechana that has to be done and then you continue with some Shamana Chikitsa?
Yes, sir. But when all the Shodhana was indicated only in Baudosha Avastha, so as it is now, as it is for 5 to 6 month history, so I not noticed that much of Baudosha Avastha in this patient. Sir.
This work was done by you, or you are presenting on somebody's behalf?
No, it's case stated by me, sir.
You have done this. Okay. because
Yes.
you have some two contrasting statement that has been given in fifth slide. You have highlighted Virechana action of Mahamanjastadi Kasha and Kaishar Gulu, and in seventh and eighth slide when you were like probable mode of action when you were telling
Yes.
seventh and eighth
Yes, sir.
slide, you have never highlighted this Rechana action. That is why I have a specific
In
question.
this, sir, promoting the blood healthy blood flow and detoxification, I was written, sir.
Yeah, but you have not highlighted that Rechana action here. In the fifth slide, you have
Yes.
highlighted.
Yes. Yes, sir.
Okay. Sir, Madhukeshwar, sir.
So how many days follow up is done in this case?
After 21 days only, sir. First one is after 21 days. After 50 days, sir.
Not 50 days. After 50 days, whether Ivana Pidaka is relapsed?
No, sir. Till now, it is not relapsed, sir.
Till now, it is not relapsed. So, okay.
Yes, sir.
Usually, Ivana Pidaka, what is the
Along
problem
with,
is?
yes, sir.
What is the problem is it relapses. It relapses because
Yes, sir.
the
Yes, sir.
ahara vihara will not be
Yes,
same.
sir.
Every day we cannot take the normal patya ahara vihara. So that
Yes,
is
sir.
relapses. That's the only question I have.
Okay, sir.
Okay, thank you, sir.
Thank you, sir.
Thank you, sir. Now we'll move on to next presentation. Dr. Abbavaram Sirichandana from BRKar Ayurvedic Medical College. Title of the presentation is A Critical Review on Malatyadi Taila in Indragupta.
రేపైతే ఉండదు ఇట్స్ ఓకే ఇట్స్ ఓకే ఓకే ఇట్స్ ఓకే అంటున్నా థ్యాంక్ యూ బాయ్
Am I visible now?
Yes, ma'am.
Hello.
Yes, yes.
Okay, okay. I'm Dr. Sirichandana from the Department of Ayurveda Samhita Siddhanta, PG second year. I'm going to explain my topic about a critical review on Malatyadi Taila and Indralupta. Coming to the introduction part, hair loss is one of the most common problems faced by many people. Hair loss as patches on particular area is called Indralupta. According to Shushruta, has described Vatapitta vitiation in its Samprapti, that shed of hair from Romakupa and further vitiation of Rakta along with Kapha causes their avarodha, thereby preventing growth of new hair. Acharya Charka mentioned that a fast-acting poison, if used in a proper way, it acts as a medicine. In Malatyadi Taila, such formulation which has been quoted in Shushruta and Baishajya Ratnavali for topical application in Indralupta. It contains Upavisha of Karavira and Chitraka along with Malati and Karanja having a base of Kira Taila. Coming to the ingredients, Malati, Karavira, Karanja, Chitraka, Kira Taila is being used. Method of preparation. In this method, swarsa taken out of Karanja Patra and Malati Patra is used as Dravadravya. The ratio of Kalka Dravya, Sneha Dravya and Dravadravya is to be taken in the formulation 1/8 is to 1:4 respectively. For the preparation of 250 ml of oil, below measurements can be taken. Karadvira 16 grams, Chitrakamul 16 grams, which is Kalka Dravya, and Sneha Dravya, which is a Kera Thailam, 250 ml is being used. Dravadravya, Karanchapatra Swarasa 500 ml, Malati Patra Swarasa has been used. Kalka is prepared and it is added to Kira Thaila. When it is started to get heated, then the prepared Swarasa of Karanja Patra and Malati Patra Swarasa is added. It is then heated to mild to moderate fire until Madhyama Paka is attained. Then Thaila is filtered out. These are the properties of ingredients which are mentioned below. Malati, the part used is tender leaf, rasa, which has rasa, tikta kashaya, and guna, lagu snigdha mrudu, virya, which is ushna virya, and vipaka, katu vipaka, which is under the varga kushtagna dashemani. Doshagnata, it is a three doshagnata, and karma, chakshushya, ropana, vrana. Karavira twak, Karavira part twak is used. Rasa katutikta kashaya is used. Guna laguruksha tikshna. Virya, which is ushna virya. Katu vipaka. Kustagna dashemani, and it has doshagnat of kafa vatahara, which is also acts like krimihara and kustahara. Chitraka, part used is root, and which is katurasa. It has a guna of lagu tikshna rukshna ushna virya and katu vipaka, which has lekaniya deepaniya vedaniya action, varga, which comes under this varga, and doshagnata as vata kafahara. It acts on deepana pachana krimihara, like that. Next, coming to karanja, twak part is used, which has katu tikta rasa, and guna lagu tikshna guna, virya ushna virya, katu vipaka, kandukna dashemani, doshagnata, which has kapha vatahara. It acts on kushta. It acts like krimihara, kushtahara, vrana shodhana. Next, Kira Taila, which has Madhura Rasa and Snigdha Guna, Shita Virya, Madhura Vipaka. It acts like Tridosha Hara. Coming to the mode of action, most of the ingredients having Krimihara and Kushtahara property. Lekaniya action of Chitraka helps in scraping of the vitiated kapha and mala. The scraping action in scalp helps in removal of hair root obstruction, and helps for regeneration of hair. Karanjapatra has Kandugna property, hence it is effective in itching. Coming to conclusion, all the ingredients of Malatyadi Taila are Ushna and Tikshna in nature. Ushna Guna exhibits Pachna of localized dosha, and Tikshna induces Shodhana of accumulated dosha. Here, the remnants of Shrotarodha of Kapha dosha at Romakupa may have been minimized with this local effect, hence probably may have contributed in reversal of Indralupta Samprapti. Thank you.
Thank you. Now I request judges to ask questions.
Doctor, have you prepared this medicine?
No, sir.
Okay. This probably is the third presenter who is speaking on Malatyadi Thailam and its effect on Indralupta. And you could try to prepare this medicine because it has only 4 ingredients.
Yeah, sir. Sure, sir. I'll make it.
And these ingredients have some antimicrobial property, right?
Yeah, sir. Krimihara property, yeah.
Krimihara property. Which type of microbes it acts? Whether it is on bacteria, virus, fungus, which kind of organisms it may probably work?
It mostly acts on fungal or bacteria, sir.
Okay. This Indralupta, what is a organism that causes Indralupta? Whether it is a bacteria origin or fungal origin?
It's a fungal origin, sir.
Yes, Madhukeshwar, sir.
Whether this Maratyadi Taila is effective in the autoimmune induced alopecia areata. It is one of the variety it can be correlated to Indrupta also. Whether it is effective?
No, sir. No idea, sir.
Yes, Crimigna property is there. That is because maybe it may act on the because of the crimi in the lupta which develops. Whether any autoimmune because of the any autoimmune disorder, so any alopecia areata is there. In that it is effective. Is there such a research article is there? Anything research article is published?
No, sir. I didn't refer.
Okay. Okay. Thank you. Thank you.
Okay, sir.
Thank you. Next Next is the last final presentation, Dr. Namrata M. from
Yes,
JSS
sir.
Ayurveda Medical College.
It acts on antimicrobial properties, sir. Yes, sir.
Ma'am, is my screen visible?
Yes, it's visible. You have to rotate your screen.
Can I start, ma'am?
Yes, you can start.
Ma'am, can I start?
Just Dr. Namrata, please continue.
Namaste all. Myself Dr. Namrata, final year PG scholar from Department of PG Studies in Kaya Chikitsa, JSS Ayurveda Medical College, Mysore, presenting before you a case study entitled as The Effect of Kramataha Shodhana in Management of Ekakushta with special reference to plague psoriasis. These are the contents of my presentation. Moving on with the introduction, Kushta is a generalized term given to all dermatological problems in Ayurveda. It is mainly of two types, Mahakushta and Shudra Kushta. Ekakushta is one among the Shudra Kushta, which is Kapha Vata predominant and characterized by lakshanas like Asvedana, Mahavastu, and Matsya Shakalopamam. Based on these invariable similarities, it is correlated with psoriasis, which is accounting around 2 to 3% of total population, and the most common type of psoriasis is plague psoriasis. The following study goes with the objective to evaluate the effect of Kramata Shodhana in management of Ekakushta with special reference to plague psoriasis. This is a single clinical case study with the intervention of Kramata Shodhana. Here, a female patient aged 16 years, a resident of Mysore, approached Kaya Chikitsa OPD of our hospital with the chief complaints of dry, scaly, elevated lesions all over the body associated with severe itching from past 4 years, aggravated from last 3 months. Lesions were first noticed over the abdomen. Later, it gradually spread all over the body. For these complaints, they consulted allopathic physician and took treatment for 4 months, but found no satisfactory result. Later, they shifted to homeopathic physician and took 2 courses of treatment for duration of 6 months and found maximum relief for over a year. But from last 3 months, complaints got aggravated, so they visited our hospital. Family history revealed that her father is a known case of plague psoriasis at his age of 32 years, and personal history reveals patient is a student and she gives the history that the lesions are aggravating during her exam time and on exposure to stressful circumstances. On examination, all vitals were stable and skin examination revealed scaly, multiple pinkish lesion over the scalp, face, neck, upper limbs, lower limbs, trunk, which were circular, and even some lesions were irregular with varied dimension. And the surface was elevated, rough, and dry. Ospit sign and candle grease test was positive. Based on this, it was diagnosed as Ekakushta, and following intervention was given considering the bala of the patient. Firstly, Vamana was administered with Madana Pippali Yoga, and patient had 6 Vegas. Based on the Vega and Shuddhi, Samsarjana was advised. After a gap of 3 days, Virechana with Trivrit Leha 40 grams was given, and she had 11 Vegas, and based on the Shuddhi, Samsarjana was advised. Once after the Samsarjana, 3 days gap was given, and Tikta Basti was planned in the pattern of Yoga Basti. Here we had given Panchatikta Gugulu Vrita 60 ml as Matra Basti and Niruva Basti with Tikta Dravya Kwata, that is Amrita Kwata, Nimba Kwata, Vasa Kwata, 100 ml each, wherein making a amount of 428 ml of Niruva Dravya. And considering Dviguna Parihara Kala after Basti, 16 days gap was given and Nasya was planned. Nasya with Sarshapa Taila, 3 drops to each nostril was planned. But on the first day, once the Taila was administered, patient started complaining burning sensation. So the dosage was reduced to 2 drops and followed by Eshtimadu Taila Pichu.
And yoga, that is Vajrakagrita used for Snehapana, is having direct indication in the Kushta, and even Panchatikta Gugulugrita, which was used, is also having the indication in Kushta. And these were the results. Once after the Vamana, patient had 70% of improvement, and after Virechana, almost 90% of the lesions got subsided, and after Basti and Nasya, almost all lesions were gone. And after taking the consent, the photographs are displayed. Before treatment, this was the condition. Once after the Vamana, this is how patient presented. After Virechana, almost all lesions went, but slight like lesions over two parts of the body was evident. And after Basti and Nasya, this is the condition, and this is the present status of the patient even. She is on follow from a year. So, Kushta is a Bahudoshaja Vyadhi involving Saptako Dravya Sangraha. Hence, Shodhana is must and should. It is correctly quoted by Acharya Charaka that Dosha Kadachit Kupyanti Jita Langana Pachanaihi Jita Samshodhanai to Na Tesham Punarudbhava. So, to avoid the recurrence, Shodhana is a prime role. And here, even Charaka correlates dosha to the plants. If not unrooted properly, it can relapse or recur. Therefore, in the present case, Kramataha Shodhana in the sequential order of Vamana, Virechana, Basti, and Nasya was planned. To conclude, Kushta is one among Ashtamahagada, which is Dirghakalanubandhi Vyadhi involving Saptadravyas. Hence, it is essential to adopt Punaha Shodhana as mentioned in the classics. In the present case, main Nidana can be inferred as Bija Dushti, and even the patient presented with Bahudosha Avastha, hence Kramataha Shodhana was adopted and it gave much beneficiary results. Therefore, Kramataha Shodhana can be adopted based on Vyadhi Bala and Vyadita Bala for the successful management of Ekakushta and to prevent further recurrence and Bija Dushti. However, this is a single case study. To draw the conclusion, we could have went for the samples in large. Thank you.
Thank you. Now I request judges to ask questions.
Dr. Namrata, you have been highlighting about Bija Dushti in the conclusion, and also there is a family history. Her father was having this problem.
Yes, sir.
And whether this plague psoriasis has this genetic particular predominance.
Yes, sir. It is having genetic predominance, and there is data showing that if it is running in the family, there is chance of transferring to the next generation in 70% of cases. There is one study, sir.
Earlier, there was a study done.
No, sir. In one of the studies,
you have published data available to prove this.
Sir, in Google, when I searched, it was showing that there is relevance of families.
Okay. In your Kramataha Shodhanam, after Vamana and Virechana, there was no gap given between Vamana and Virechana, and between Virechana and Basti, there was no gap given. But
Sir,
after Basti, there was
no, sir. Once after Vamana, 3 days gap was given after Samsarjana, sir. After Virechana also 3 days gap, and Dviguna Pariyara Kala after Basti was planned, sir.
Okay. After Samsarjana Karma, there was gap given.
Yes, sir.
Okay. I have a very specific question. For Vamana and Virechana, for Snehana, you have used Vajraka Sneham.
Yes, sir.
Vajraka Gritam. And for Vasti, you have used Panchatiktagam. Any specific reason?
Sir, as it Tikta Dravya was needed, then Vajrakagrita, Panchatikta has that all Nimbamrita, Vrishapatola, Nidikta, no, sir.
Then you could use it for Snehapana also during Vamana and Virechana. No, my question is whether there is any specific reason or it is based on availability or cost.
Sir, Vajrakagrita, actually we were preparing in our hospital, sir. Okay. There is one even study going on in Ekakushta, sir. Okay. So it was properly prepared by ourselves. So we tried it in Vamana and Virechana. The results were good. Okay. So to change with that, we adopted Panchatikta.
Okay. Whether any Shamana Ushadhi was given?
Yes, sir. Patient was on Trifala Kwata and Kadira Arishta and 777 oil for external application with Aragyavardhini Vati TID, sir.
Okay. That's a good work. You continue with Pakshat Vamanam, Masi Virachanam. You continue that.
Yes, sir.
Okay. Thank you.
Thank you, sir.
Yes, one small doubt. It's not a question. Is that all the karma which is pakshat, vamanam, greshana, nasya, basya, all is carried out in this patient. Why raktamokshana is left out?
Sir, actually, after Virechana, we thought of going for Raktamokshana itself, sir. But patient was not ready to take Siravyada. We had planned for Siravyada, but patient was not ready.
Okay.
So we opted for this Basti. And in next setting, we have advised to go for Raktamokshana once. So in next follow-up, she might agree.
Okay. Thank you.
Thank you, sir.
Thank you. Now we have come to the end of the session. Now I request Dr. Govinda Sharma sir to share his opinion on today's session. Sir, switch on your video.
Yeah. Good evening, everybody. First of all, I congratulate Aptas Ayurveda, Dr. Sharat Kumar and members of Aptas Ayurveda for having this beautiful idea of conducting Punarvasu. And as it is a one-day session, to have an elaborate discussion on all the topics of presentation, they have planned for pre-conference presentations online, so that presenters also will get sufficient time to present their ideas. And also there will be a good discussion that is done on each presentations. With that idea, they have come up with this presentations on day-to-day basis. Today probably is the second day of presentation, and we had 22 presentations. Probably 2 or 3 are absent. So out of 22 scheduled, we have completed around 18 or 19 presentations, and I congratulate all the presenters for their hard work which they have put for collecting the data and presenting the data. But what I have observed is, except for 2 presentations, one is this case study which is presented by Dr. Namrata, and another case study which was presented earlier by a student from Bagalkot, all others were of mostly are of review or were presented based on the researches done by others. So I take this opportunity to give a call to all the PG scholars that you can have such works, simple works of either preparation of medicine and standardization, or preparation of some rare medicines, or modification of one existing dosage form to another dosage form for the need of convenience or feasibility, or doing a case study or case series. Such works are needed in Ayurveda for generating evidence. So people are looking at us. We have to generate data, and we have to prove that our medicines are really safe and effective. I had very specifically asked 2 or 3 students who have presented. They have concluded that the medicines are safe and effective. And I had a very particular question to them, like, what is the data to prove the safety of your formulation? Specifically on that Lomashatana lepas that was presented by some student. I have very particularly asked, what is the data to prove that the medicines are safe? So the people are asking now. People are looking for research data to prove that our medicines are safe. And of course, efficacy studies are being done. Many centers are doing efficacy studies, but safety studies are really lacking in Ayurveda. So if we claim that our medicines are safe, we have to prove it. We have to generate the data to prove that the medicines are safe. And I had a very particular question to some student that she was telling that it is cost effective. That is also actually as a need of time. Lot of medicines are available in the market, and if you can generate a product which is really comparatively cheap than the products that are available in market, that is also a really good contribution to the science of Ayurveda. So if you are claiming that it is cost effective, then really prepare that medicine and see that it is really cheaper than the products that are available in the market. So with these 2-3 lines, it is already late. I congratulate all of you for your efforts which you have put in preparing these beautiful slides and the contents that are collected from different books and journals. And I appreciate all your efforts. And if you have asked any specific question, is just to pull more data from you. It is not to hurt your feelings. And if you have felt otherwise, please forgive us. And we have asked with the best interest of the knowledge and the science. It is nothing personal. And with this, I again appreciate the efforts of Aptas Ayurveda. They are doing a great work in the memory of late Sri Srinivas Acharya sir, who is a guru for all of us. And this Punarvasu is being conducted in the fond memory of late Srinivas Acharya sir. Let us all join our hands and let us gather in Davangere to make this event a grand success. And also appreciate the efforts of Dr. Ananya and Dr. Mahesh Hirulal in conducting this event. And I thank Dr. Madhukeshwar Hegde sir for cooperating with me. Thank you very much.
I request Madhukeshwar Hegde sir to share his opinion on today's session.
Thank you, madam. First of all, I congratulate the Aptas team for conducting these kinds of online presentation, and I congratulate all the presenters, those who have presented in today's session one. All the presentations were good, and new ideas will come out from this kind of presentation. And I also congratulate the Aptas team for giving the opportunity to share screen with the eminent personalities like Govind Sharma sir. And it's a opportunity me to learn few things from this presentation one. And my only one request is more practical approach is required while formulation while presenting the formulations and all, because some formulations we do it in we will tell it in the presentations or seminars, but practically it is very difficult to perform, like Hasdantamasi and some of the pushpa lepa and all. It is a seasonal, and to come out with any product from these formulations, it requires a lot of modification is required. So, a more practical approach is required to make a formulation from a textbook to a market one. So, such studies will be better for our future one. Thank you. Once again I congratulate the all the Aptas team, Dr. Sharat sir and Mahesh sir, and all the teams of Aptas. Thank you, one and all.
Yes, sir. Now I request Dr. Sharat Kumar sir for vote of thanks.
So, namaste to all. So this was really a good presentation where we have fulfilled our desire. Like initially we have planned that all the presenters should be asked with questions, because these days we have seen a trend where people are attending seminars only for the sake of certificate. So we wanted to create a difference as an organizer, and so with the help of Dr. Govind Sharma sir and Madhukeshwar Hegde sir, we have achieved this target. So I wholeheartedly thank on behalf of Aptas Ayurveda to the judges of the today's session, Dr. Govind Sharma sir and Dr. Madhukeshwar Hegde sir. Both are associated with Aptas, and always if we approach both of them with any of the ideas, they will be always positive in supporting to us. And this is really thankful, sir. And I also thank all the presenters because of whom this whole session has been conducted. So I thank all the PGs and the coordinator of PG sessions, Dr. Mahesh Hirulal sir, Dr. Chandumetri sir, and Dr. Venkatesh Kauder sir. And I also thank Dr. Ananya Lata, who has been patiently handling the whole session as a moderator. And with these words, I conclude today's session. Thank you, one and all. Shubhai.